The Committee of Finance is hereby called to order. Madam Clerk, can I have a roll call, please?
Senator Marvin A. Blyden. Senator Blyden, present. Senator Samuel Carrion. Senator Carrion, absent. Senator Dwayne M. DeGraff. Senator DeGraff, present. Senator Donna A. Fred Gregory. Senator Fred Gregory, absent. Senator Javon E. James Sr. Senator James Sr., present. Senator Janelle K. Serow. Senator Serow, absent. Senator Kurt A. Vialet.
Here.
Senator Vialet, present. Mr. Chair, you have 4 present, 3 absent.
Thank you, Madam Clerk. Senator, please mark Senator Carrion as present.
Mr. Chair, you have 5 present, 2 absent.
Thank you, Madam Clerk. Any correspondence?
Yes, Mr. Chair.
You may proceed.
Correspondence dated August 15th, 2022. Honorable Kurt A. Vialet, Chairperson, Committee on Finance, Legislature of the Virgin Islands, 3022 Estate Golden Rock, Christiansted, St. Croix, Virgin Islands. Dear Senator Vialet, please accept this letter as a formal notice of my absence from the Committee on Finance meeting of August 15th, 2022, which is scheduled to begin at 9 a.m. in the Earl B. Otley Legislative Chambers on St. Thomas. Thank you for your consideration in this matter. Sincerely, Donna Fred Gregory, President, 34th Legislature of the Virgin Islands.
Thank you, Madam Clerk. Please mark Senator Fred Gregory as excused. Any more correspondence?
No, Mr. Chair.
You may proceed and read the agenda into the record.
The Committee on Finance Fiscal Year 2023 budget hearing for Monday, August 15th, 2022 at 9 a.m. in the Earl B. Otley Legislative Hall, Charlotte Amalie, St. Thomas, U.S. Virgin Islands. The Committee on Finance will receive testimony on the proposed fiscal year 2023 executive budget for the government of the Virgin Islands of the United States. At 9 a.m., Schneider Regional Medical Center. Invited testifiers, Tina Comissiong, Chief Executive Officer. At 12:30 p.m., St. Thomas East End Medical Center. Invited testifiers, Moleto A. Smith, Jr., Executive Director. At 2 p.m., Law Enforcement Planning Commission. Invited testifiers, Angel Campbell, Director. Mr. Chair, this concludes the reading of today's agenda.
Thank you, Madam Clerk. I'd also like to welcome Senator Kenneth Gittins. Thank you for coming. Good morning to the people of the Virgin Islands. Good morning, colleagues. Good morning to the testifiers. We are beginning this morning with Schneider Regional Medical Center. I'm going to give the Chief Executive Officer an opportunity to put her name and title on the record, and then we'll proceed with the other individuals who are here to support her testimony. I asked that question about 5 times. Thanks for putting on a big screen. Senator Novel Francis, thank you for joining us. Senator Novel Francis. Thank you for joining us. Somebody over here whispered and said, that is, Senator Gittins have joined us, and I am peeping, the screen was small, and I'm like, no, that can't be Senator Gittins. And I asked you, Senator Francis blamed Samantha. I said, Samantha, is that Senator Gittins? And she said, I ain't sure, I think so, no. What a mistake. What a mistake. Please, Senator Gittins is not here yet. Senator, our regular member, Senator Novel Francis, is here. We missed him about 2 days, so 2 times, so we lost him for a bit. Okay, we're going to proceed and let you put your name and title on the record. CEO Comissiong.
A pleasant good morning, Honorable Chairman Senator Vialet. My name is Tina Comissiong. I'm the Chief Executive Officer for Schneider Regional Medical Center.
Okay, and then now to my left.
Good morning, Senators. My name is Stephen Mayers. I'm the controller at Schneider Regional Medical Center.
Next.
A pleasant good morning to this honorable house. My name is Valda Bruno Durand, and I'm the HR recruiter at Schneider Regional.
Next.
Good morning. My name is Yvonne Thomas, Interim Chief Nursing Officer.
Good morning, Senators. My name is Peter John Baptiste, VP of Facilities at Schneider Regional Medical Center.
Good morning, Darryl Smalls, Executive Director, Territorial Hospital Redevelopment Team.
Okay, thank you so much. I see some new faces today. So welcome to all the new individuals to the legislature. At this point, we're going to proceed and let Ms. Comissiong begin with her testimony. Also, before you begin, thanks, Mr. Bolquist, Senator Bolquist. Thank you for joining us this morning also. You may proceed.
Thank you, Senator. A pleasant good morning, Honorable Chairman VLA, to all the members of the Finance Committee, to the senators of the 34th Legislature, and to the listening and viewing audience. I am Attorney Tina Comissiong, Chief Executive Officer of Schneider Regional Medical Center. I am honored to appear before this committee to present testimony on SRMC's Fiscal Year 2023 budget. Here with me today are some of the members of SRMC's leadership team, including Mr. Stephen Mayers, Controller, Dr. Cecilia Penn, Interim Chief Medical Officer, Ms. Yvonne Thomas, Interim Chief Nursing Officer, Dr. Delphine Olavaci, Vice President of Quality and Performance Improvement, Mr. Christopher Borgensen, Vice President of Operations, Mr. Brandon Richardson, Vice President of Information Systems, Mr. Peter John Baptiste, Vice President of Facilities and Engineering, Attorney Sulaine Walker, Legal Counsel, Ms. Valda Bruno, Human Resources Recruiter, and Mr. Darryl A. Smalls, Executive Director of the Territorial Hospital Redevelopment Team, who will later provide an update on SRMC facilities rebuilding. I would like to start off today by acknowledging and thanking our governing board members, our medical staff, and our dedicated team of employees at the Roy Lesser Schneider Hospital and the Myra Keating Smith Community Health Center for all that they do to support our hospital and clinic, our patients, and our community. In our testimony today, SRMC presents a conservative, balanced operating budget of $88,565,322 for fiscal year 2023, which includes the proposed GVI appropriation of $28,750,000. We will also discuss our top strategic initiatives, the challenges within the local and national healthcare environment, opportunities that we are pursuing, and the advancements that we have made since we last appeared before this committee. For our budget overview, SRMC's operating budget for FY 2023 is $88,565,322. 68% of our operating budget is generated by the work that we do, providing care and services to patients, and then billing and collecting for the services we provide. The remaining 32% of our budget comes from our monthly allotments from the government of the Virgin Islands. The significant bulk of the money that we use to operate the hospital and our clinic is produced by the hardworking professionals of SRMC. I'd like to share with you some of our strategic initiatives. Schneider Regional Medical Center's 5 most important strategic initiatives for 2022 to 2023 are improving our financial position to become more financially stable through revenue cycle improvements and expense reduction, increasing our permanent staffing to ensure safe, quality patient care with balanced patient-to-staff ratios and to reduce our reliance on expensive temporary staff. Upgrading and enhancing our technology to improve efficiencies in patient care and to enhance the overall patient experience. Improving our supply chain management to consistently give our providers what they need to care for our patients at the best price. And enhancing and modernizing our facilities to ensure a safe environment for patients and staff. So far this year, We have made good progress in advancing these 5 strategic initiatives. But our organization continues to be challenged by several local and national market factors that we will highlight in today's presentation. The local and national market factors create a difficult environment. We are actively working as a team at SRMC to improve our revenue generating and collecting activities to become more financially solvent. However, as an organization, we are contending with shortages in permanent staff that result in the use of expensive contracted labor, an unfavorable payer mix, high numbers of unsafe discharges or boarders due to lack of placement options, higher acuity presentations at our emergency department due to insufficient primary care, many victims of gun violence who present for care, and an aging facility. These factors combined have had an impact on SRMC's financial stability. First, shortages in primary staff have resulted in the use of expensive contracted labor. Industry experts report that across the United States, approximately 40% of registered nurses, otherwise known as RNs, are projected to leave healthcare in the next year as they experience burnout, work-related stress, retire early, and switch careers. The current nursing shortage, which has been on the rise since 2012, is now considered the greatest the U.S. has ever seen. The number of available nurses simply does not meet the demand in the United States. It is projected that this shortage will continue to intensify over the next 16 months. In 2021, SRMC lost 80 FTEs, 21 of whom were registered nurses. And thus far, for 2022, we have lost 34 FTEs, 11 of whom were registered nurses. For 2021, SRMC's staff turnover rate was 15%, which is slightly below the rising national average of 17%. It is costly to replace the permanent staff members that we lose with temporary staff, and the training associated with turnover impacts the organization on average by about $20,000 per nurse. SRMC requires 186 registered nurses to support our 75-bed inpatient occupancy and our outpatient and emergency room services. Currently, SRMC has only 72 permanent full-time registered nurses, 5 permanent part-time nurses, and 26 permanent per diem registered nurses. Thus, we are only 39% staffed with permanent full-time RN staff. We do supplement our permanent staff with contracted staff. We currently have approximately 17 PAFRD registered nurses and 32 contracted or travel agency registered nurses. We also contract for 10 allied health technicians, but our permanent staffing is at a critically low level. SRMC receives some staffing assistance through the Department of Health with PAFRD, and we want to thank the Commissioner of Health, Ms. Husa Encarnacion, for the help that we receive to supplement our staff. However, as PAFRD does not meet all of our needs for supplemental staff, we still rely heavily on expensive travel agency contracts. At SRMC, the cost to employ locum tenens or temporary traveling physicians is also very high, especially as it relates to filling anesthesia and midwife staffing gaps. We are currently using approximately 9 locum tenens physicians at Schneider. For Schneider Regional Medical Center to have a full complement of physicians and mid-level staff, we need to add certified registered nurse anesthetists, midwives, cardiology, gastroenterologists, nephrologists, advanced practice registered nurses, an anesthesiologist, and an emergency room physician. In fiscal year 2016, before the hurricanes of 2017, SRMC spent approximately $3.7 million on temporary contract staff. That increased to $7.2 million in fiscal year 2021. Of the $7.2 million spent in fiscal year 2021, $4 million of that was in temporary physician and mid-level staffing, and $3.2 million was in nursing and allied health staffing. Our spending on temporary contract staff is already at $6.5 million as of July 2022, which includes $2.6 million for physician and mid-level staffing and $3.9 million for nursing and allied health staffing. We are currently spending more than $300,000 every 2 weeks for contract nurses, and we must pay some of these companies bi-weekly to keep staff on site. We project that our spend on temporary contract labor will hit almost $8 million by the end of fiscal year 2022. This trend of increased spending on contract labor is not unique to Schneider Regional Medical Center. The average annual cost for hospital contract labor has more than doubled in the last decade. Our current spending on temporary contract staff is not sustainable. With the onset of COVID, price increases in the healthcare labor market have been dramatic, and we have not adjusted our permanent staff salaries to be competitive in the national market. Many of our talented employees have left for better paying opportunities. To compete with them and for them, we must be fair and realistic in terms of our salary offers and the high cost of living in the Virgin Islands. Our average RN salary is approximately $68,000. The pay scale for registered nurses in the Virgin Islands at the territory's hospitals is currently set at $63,000 for registered nurses with 0 to 2 years of experience and $79,000 for registered nurses with 16 or more years of experience. The average national RN salary in the US is $80,000, with nurses in California averaging the highest at $120,000. Nurses in Washington, D.C., which is a jurisdiction of comparable size and expense, earn on average $103,000 per year. Attracting talented clinical professionals to our team as permanent staff members has also been challenging due to external factors such as the high cost of living and the lack of affordable housing. Additionally, the requirement for employees to participate in GERS and absorb an 11.5% deduction has been a huge deterrent to acquiring and retaining full-time employees. The difference between what a nurse takes home on his or her paycheck in the Virgin Islands and how far it goes here versus what they take home and spend to live comfortably in some states on the mainland is often too large of a gap for us to be competitive. To improve our rate of success in recruiting and retaining permanent staff, SRMC must improve the base salary for nurses and other clinical professionals. The salary increases for nurses at SRMC are projected to cost approximately $3 million per year. During the Committee on Health, Hospitals, and Human Services hearing on July 29th of this year, local nurses highlighted the salary gaps and salary issues and the work conditions that must be addressed if we are to be competitive with the national market. SRMC has engaged in pre-negotiation management meetings with both the Juan F. Louis Hospital and the Department of Health, which were hosted by the Office of Collective Bargaining for the nurses' unions. SRMC is eager to move forward with a new salary table for all three of the nursing unions, which include the LPNA, or Licensed Practical Nurses Association, VISNA, or the Virgin Islands State Nurses Association, and RNLU, the Registered Nurses Leadership Union. We look forward to the start of these negotiations, and we need financial support to effectuate the new RN salaries. We hope and anticipate that the newly negotiated pay plans for our nurses will take effect at the beginning of fiscal year 2023. The chart below, which we've shared represents the estimated total cost for salary increases for nurses at SRMC and includes the fringe benefits based on projections for the new pay plans. So for VISNA, we anticipate salaries increasing on top of what they are right now by a factor of $2.1 million, with associated fringe of $161,000, for a total increase for our staff nurses of $2.27 million. That includes our advanced practice nurses. For our registered nurses leadership union, we anticipate in excess of $500,000 of an increase to our base and salary expense, additional $40,000 as fringe expense, for a total additional impact to our budget annually of $565,000. For the Licensed Practical Nurses Association, we anticipate the increases costing approximately $190,000, fringe associated with that being $59,000, for a total impact to our budget of $248,000 approximately. So the estimate for the total of the salary increases, including fringe, is approximately $3.08 million. In addition to fixing the base salaries, SRMC will offer retention bonuses of approximately $5,000 to $7,000 annually to registered nurses, and other critical clinical staff. These retention bonuses will be funded using the $10 million of ARPA funds that were allocated to the hospital by Governor Bryan. $8 million of the $10 million that was allocated to Schneider will be distributed to Schneider over 4 years at a rate of $2 million per year for these retention efforts. $2 million of the $10 million will be allocated for the technical consulting component of the Meditech Expanse upgrade, which will be discussed later in our testimony. We remain optimistic that with the development of competitive compensation packages, our recruitment and retention plans will take hold and will result in a reduction in staff turnover and an increase in our permanent staff, and will reduce our reliance on expensive temporary contract agency staff. We'd like to highlight the payer mix that exists in our environment, which is unfavorable. Over 76% of our patients have Medicare, Medicaid, or no insurance. Those without insurance are considered self-pay. SRMC is reimbursed below cost for all of these patient encounters, 76% of our business. To provide this committee with an example of an inpatient experience, SRMC provided inpatient care to one Medicaid patient totaling $17,061 in charges, but only received the daily rate of $1,654 from Medicaid. To give an outpatient example, SRMC performed a knee replacement surgery for a Medicaid patient who needed that service and billed $34,000 to include the OR time, the components actually used in the surgery, the hardware of the knee replacement, and only received $402 of that $34,000 bill. SRMC's payer mix is broken down as follows: 39.3% Medicare, 25.6% Medicaid, 12% self-pay, 11.9% Cigna, 6.6% other commercial entities, 2.3% Blue Cross, 2% other insurers, and lastly, workman's compensation at 0.5% of our business. Our charges for Medicaid patients for FY 2021 totaled $37.4 million. But based on the daily rate that's allowed by Medicaid, we were only eligible to collect $12.6 million of that. And we were not even able to fully collect the $12.6 million due to delays in claims being processed and claims not crossing over correctly to their system. We acknowledge that we must continue to build the community's trust in the care we provide, and we must do more to capture the commercial insurance market, like government employees with Cigna, by improving our delivery of service. Before the opening and expansion of the private surgical centers in 2005, SRMC did many more surgical cases per month than we do today, and we have to get back to that. Further, much of the outpatient upstream and downstream activities like radiology, the pre-surgery workup, and the post-surgery rehab have also left. We have to encourage some of this business to return to the hospital. The hospital is obligated by law to take care of everyone who needs care, regardless of their ability to pay. Much of the insured business that's left the hospital and gone to the private centers and off island has worsened the payer mix at the hospital and leaves us with less to take care of the persons who cannot pay for their own care. As many as 10% of persons who present to our hospital system are classified as self-pay, and we receive almost nothing, about 10 cents on every dollar we bill when we bill for their care. Despite the existence of hospital presumptive eligibility, or the HPE program, which is offered through the Department of Human Services and allows some persons who present to the hospital as self-pay an opportunity to be enrolled in the medical assistance program, we still have high numbers of true self-pay individuals. This is because many of our patients do not qualify for HPE, mostly due to not being a resident of the Virgin Islands for 5 or more years, not having a social security number, being undocumented, or because their income threshold exceeds a certain level. If you make more than $15,654 as a single individual, you cannot qualify for Medicaid. 29% of persons who presented to SRMC for care without insurance did not qualify for HPE. Further, there are very few private insurance options available in the VI. Many persons who live and work here do not have access to affordable health insurance, and they opt to go without a health insurance plan because it's too costly to participate. It can cost more than $3,000 a month for an individual to get a private health plan in the VI, which is not a reality for many people. As mentioned, SRMC must provide care to anyone who presents to our hospital, regardless of their ability to pay. When patients without health insurance coverage present to our hospital and they cannot qualify for presumptive eligibility, but they require care, we provide it, including air ambulance transport out of the territory. Even when they need care that SRMC cannot provide, we make that connection to care for them. There are certain services that we can't provide, such as some neurology cases, pulmonology cases, some complicated orthopedic cases, and for some cardiology cases. And SRMC is left with covering those costs. We're unwilling to let patients suffer and unwilling to stop at the blurry, somewhat gray line of where our legal obligation ends. For each medical flight where we have to send a patient out of the territory, it can cost upwards of $25,000. A total of 143 patients have been transferred off island in the past fiscal year, and several of them were self-pay, which left SRMC to absorb that cost. Lastly, but importantly, the payer mix is unfavorable also because many persons who can afford to go off island and who have good insurance like Government Cigna choose to have their care performed off island. Significant revenue leaves the territory every year rather than being expended on island and circulating in our economy. We continue to work to build the community's trust in the high reliability services provided by SRMC. We know we have great providers and provide a high standard of care, and we want you to trust us with your care and choose SRMC. We hope that we will be the first choice for all services that we offer, and that we can find creative ways to incentivize Cigna and other private insurance beneficiaries and others with commercial insurance to choose SRMC for their care. Achieving that better payer mix is critical to the hospitals becoming more self-sufficient. Some of the work must be done by us to convince the public to come to us for their care, but this will also require partnership and efforts between SRMC and government stakeholders and policymakers to achieve this. If nothing in the environment changes, then the hospital will continue to need the support and infusion of cash from the VI government to be able to operate a safety net hospital. We request that this body work with us at reshaping the larger healthcare and insurance landscape. We will discuss our unreimbursed lengths of stay, which are long, and high numbers of safe discharges or boarders due to lack of placement options in the territory. Currently, our territory has no nursing homes, long-term care facilities, or inpatient rehab facilities. This leads to SRMC having high levels of unsafe discharges, more commonly known as boarder patients. These are patients that remain in the hospital long after their acute care is complete. SRMC receives little or no reimbursement for care provided to its boarder patients. Currently, SRMC has 11 patients who are classified as unsafe discharges or boarders, who need to transition to nursing home care, long-term care, or residential assisted living. Some of these patients have been in-house at the Royal Leicester Schneider Hospital since 2018. Unsafe discharges drain our resources and cost the hospital millions of dollars each year at the Medicare rates. The annual cost for an adult boarder at the daily Medicare rate of $1,475 is approximately $538,000 for the year. With 11 boarders at SRMC, we expect to spend at least $5.9 million this year just to care for our boarder patients. Additionally, boarder patients occupy acute patient care rooms, which impacts our ability to move patients up to the floors from the emergency room to the inpatient units. And this is a significant contributing factor to long lengths of stay and extended stays in the emergency room and to increased wait times in the emergency room. At Schneider, we also see higher acuity presentations due to a lack of primary care in our community. A variety of factors, including insufficient primary care in our community and a historical failure to address the social determinants of health as a territory, has led to persons coming to the hospital sicker and in need of more expensive and more prolonged episodes of care. As part of thinking about the larger healthcare landscape in the Virgin Islands, we have to start focusing and increase our focus on population health as a territory. If we focus on a comprehensive approach to health and wellness for residents in our territory, it will help to reduce the burden on the hospitals. Also, we provide a significant amount of unreimbursed care to the many victims of gun violence in our community. Unfortunately, our environment is considerably affected by violence that results in person needing surgical and other medical services at our hospital. SRMC has provided care to approximately 55 gunshot wound victims, totaling more than $1.6 million in related charges from January 2021 through June of 2022. These cases often require a full call team of clinical professionals, including surgeons, anesthesiologists, and certified registered nurse anesthetists and nurses to come in after hours. It requires the administration of expensive blood products and the use of significant supplies, and it requires many days of inpatient post-operative care. Many of these gunshot victim cases were uncompensated care for which SRMC received no reimbursement. We are working with the Office of Gun Violence Prevention to provide timely information when we encounter victims of gun violence, and we partner with all the efforts in the community to reduce gun violence. Lastly, we have an aging facility. Standard accounting practices suggest that based on the age and expense of our physical plant, $3.98 million is the minimum expenditure necessary per year to maintain and incrementally upgrade the existing infrastructure. The average age of the plant at SRMC is 30 years. We spend a significant amount on maintaining our aging equipment and our infrastructure every year, especially since the 2017 hurricanes. And we are looking forward to the rebuilding of our facilities, which we will hear more about today from Mr. Darrell Smalls. So what SRMC is doing despite these challenges? I'd like to spend a little time focusing on that. Despite the challenges that we face that I've just outlined on the local and national landscape, SRMC is working hard to increase current volumes add new services, to drive collections, to actively recruit permanent staff, to continuously maintain and monitor our quality and performance. We are launching new marketing and community engagement initiatives. We're pushing technology upgrades. We're upgrading our facilities and infrastructure, and we're reducing our operating expenses. And I will spend a little time going through what exactly we're doing in each of those areas. Working to increase current volumes and adding new services. Our in-house patient census has been consistently high this fiscal year, with SRMC recently having 77 patients admitted on many days. In FY 2021, SRMC treated 14,383 patients in our emergency room, and we have treated 13,250 patients approximately so far in fiscal year 2022. We had 2,880 admissions to our hospital in FY 2021 and 2,314 so far in 2022. In FY 2021, we had 1,770 encounters in our rehabilitation division, and we've had 1,090 so far in 2022. In FY 2021, we conducted 2,516 diagnostic imaging tests, and we've conducted 2,225 so far in FY 22. Our hemodialysis unit is very busy. We had 10,058 visits in FY 2021 and 8,083 so far in FY 2022. Our operating room completed 1,142 surgeries in fiscal year 2021, and we have completed 816 surgeries so far in FY 2022. The wound care division, which we have restarted and grown, had 521 patients in FY 2021, and we have had 1,847 patients so far in 2022. We have a very busy laboratory. It processed over 118,518 tests in FY 2021, and we've processed 111,847 tests so far in FY 2022. We have increased our volumes and our services with the additions to our medical staff in fiscal year 2022. We've added a radiologist, a pulmonary and critical care physician, a general surgeon, an anesthesiologist, an internal medicine physician, and an emergency medicine physician. Additionally, we have successfully onboarded an advanced practice registered nurse for our emergency department and a clinical nurse midwife. We're working hard to drive collections and increase revenue. The SRMC leadership team continues to be focused on revenue cycle improvements, specifically on our billing and collecting activities. We have examined our internal processes and have taken actions to ensure improved efficiency and productivity. Where we identified a lag in physician documentation, we revised the process for ensuring that documentation is reviewed for completion, and we established office space in our health information management department so the physicians can complete uncoded or incomplete charts directly. We revised locum tenens contracts and policies to ensure that documentation is completed before they leave island. We have also determined that it would be beneficial to increase our complement of billing and collection staff, and we're actively recruiting to fill these critical positions. Also, we have been working diligently to ensure that all persons who are eligible for the HPE program described earlier do apply for assistance and are enrolled, and we are working to help them to convert to the full Medicaid. We are also happy to report our gross monthly patient billing is up. It now averages between $10 million and $12 million per month. However, due to high contractual adjustments that are made to our rates by Medicare and Medicaid, some of which were described earlier, and our high self-pay population, SRMC only collects between $4 and $5 million per month. We have an opportunity to improve that as we work through challenges with our collections process. With the contractual adjustments, for every dollar we bill with no error, SRMC only expects to collect, on average, 55 cents on the dollar. So our goal for FY 2023 is to bill with no error or reduced error and improve our actual collections up to $6 million per month. Our audited financial statements from fiscal year 2020 shows that SRMC has generated $46.8 million in revenue in 2020. In fiscal year 2021, we generated $47.8 million in revenue. And so far for this fiscal year through May, we have generated approximately $43 million in revenue. We're projecting to generate approximately $59 million in revenue by the end of fiscal year 2022. And we forecast $59.5 million of revenue for fiscal year 2023. With our revenue that we generate, combined with the GVI appropriation of $28.75 million, SRMC will have total revenue of $88.5 million in fiscal year 2023. SRMC is improving its billing and collecting in several ways. We are working to cut down days of discharge to final billed, and we are working to provide estimated bills at discharge. We are being more proactive in pursuing denials, and we are reviewing our coding processes to be sure that we are appropriately capturing all charges to receive the maximum reimbursement possible for the services that we provide. We also performed a charge master review for our pharmacy and operating room, in which we reviewed our coding for accuracy, which will help to assist in decreasing denials and in increasing revenue. We have added new technology, such as Craneware, which is a tool that will help us to determine medical necessity for outpatient services. We are also now utilizing online bill pay. We've made it available on our website for our patients' convenience. One of the things we're most focused on is working to increase our permanent staffing levels. In FY 2021, we recruited 56 FTEs. To date, for FY 2022, we have onboarded 51 FTEs. We are pushing to increase our permanent staff, especially in nursing, to create better nurse-to-patient ratios, to increase patient safety and satisfaction, and to create a less strenuous work environment for our staff. We are acutely aware of the need to recruit aggressively to cover current clinical staffing shortages, and we are marketing and advertising in new, innovative ways. As soon as possible, but within the next 2 to 3 years, our goal is to identify and recruit at least 80 additional clinical professionals, which includes 10 physicians, 60 registered nurses, and 10 allied health technicians to support our operations. We are using online advertising through Facebook, Indeed, NeoGov, and nurses.com to fill clinical positions. We are working with Google to get site optimization, which will help to improve the user experience, our site engagement, and the traffic as we advertise our vacancies. All positions are posted on Indeed on a weekly basis. Additionally, we are boosting our local recruitment activities and advertisements. We plan to recruit registered nurses in Puerto Rico and other islands where the University of West Indies campuses are located. We have successfully completed the H-1B visa process for 3 lab technicians and a registered nurse. We are working with OCB and other management entities to renegotiate the salary rates for nursing and other critical clinical professionals at SRMC so that we can become more competitive in the global market where these professionals are in short supply and high demand. We need financial support to advance this initiative. To create a steady influx of local talent and to strengthen our workforce capacity, SRMC has and continues to collaborate with the UVI School of Nursing BSN program. Of the 11 students who graduated from the UVI SON program in 2021, 5 have been employed as registered nurses at Schneider Regional, and 1 as a patient care technician as they work to pass their board exam. We actively pursued all of the graduates, but other graduates, for reasons beyond our control, opted not to join SRMC. Of the 20 graduates of the UVI BSN program in 2022, 2 have already been onboarded at Schneider Regional as PCTs who are working to pass their board examinations. And we continue to recruit all of the graduates of the UVI BSN program this year as they complete the licensure process and achieve their registered nurse status into permanent positions. Every year, we invite the graduates to a breakfast, and this year we conducted in-person, on-the-spot interviews. Some of the graduates relayed to us that they want to choose to focus solely on passing their board examination first, and so declined to join the team as PCTs or graduate nurses until they complete their examination, but expressed an interest in coming on board with us once they had. We've also continued our engagement with the Ralph O. Wheatley Skill Center Practical Nursing Program to facilitate clinical rotations for approximately 23 clinical graduates in FY 2022, 3 of whom are currently employed at SRMC. SRMC also conducts our own in-house training and development programs to grow our staff into new clinical roles. We have the UVI CEL, American Heart Association Life Support Certification Program. We have a telemetry technician training program, which has 10 employees who have gotten nationally certified. We have a patient care attendant program, which we initiated in 2021 to provide additional trained staff members to assist the patient care on our nursing units. And we've started a hemodialysis technician training program in 2022. All of these programs have resulted in permanent hires for SRMC. SRMC continues to seek creative ways to grow qualified talent. We offer ongoing training and education that's tailored to our staff's specific disciplines through our Relias platform, which is an e-learning database designed for healthcare. Throughout the year, we also continue efforts to build a strong workforce from within by providing advancement opportunities. And this year, we have had 39 employee promotions from various disciplines and departments. Based on recent legislation, we will start advertising for retired nurses and retired medical technologists to return to work on a part-time or per diem basis in support of our in-house training programs. Our programs are offered in conjunction with our SRMC Nursing Educational Institute, which provides ongoing renewal of required staff certifications, including basic life support training, advanced cardiac life support training, and CPI, to ensure compliance with regulatory standards. We provide these training opportunities in-house, and it results in cost savings to SRMC of over $50,000 annually. We thank the members of our team for partnering with us in these employee development and training programs, and we invite retired nurses and medical technologists to rejoin our team to help to give back and train our new generation of healthcare workers. SRMC is investing in growing our local talent early, and we are promoting careers in healthcare. We have begun collaborative efforts with the Department of Education over the past year to engage middle school and high school students to encourage them to join in the field of healthcare. We've started some of that planning and hope to roll out these new programs with the start of this calendar school year. Our medical staff office works on recruiting permanent physicians with companies such as Medical Ambassadors, Locum Tenens, Global Medical Staffing, and Barton Associates, and by posting on specialty-specific job boards and association bulletins. As part of our online recruiting campaign, individuals interested in employment at SRMC can apply online at hr@srmedicalcenter.org or can visit our website at www.srmedicalcenter.org for more information. We truly believe that our beautiful location and culture can be attractive to clinical providers. We want to offer competitive compensation packages to attract and retain qualified talent to support our operations. And we want to allow our clinical providers to perform meaningful work. These two have been identified as the main reasons why clinicians stay with an organization. In keeping with our commitment to fostering an engaged workforce and to promoting retention, our leadership team maintains open lines of communication with staff through daily huddles, monthly meetings, employee surveys, and leadership rounding in all departments. We sponsor activities such as walks, picnics, fairs, and other fun events to build camaraderie amongst our staff. SRMC continues to find creative ways to celebrate, recognize, and reward our employees. We are cognizant that monetary compensation will aid in retention, and we are prepared to issue the retention bonuses made possible by the ARPA funding granted by the governor, for which we are so appreciative. We have processed and started releasing the premium pay payouts. We want to thank the central government for this monetary recognition to our hardworking staff who worked tirelessly through the pandemic. Across the country, hospitals and healthcare facilities are cutting services due to staffing shortages. We don't want to do that here. At SRMC, we are fully cognizant of our need to provide care to the community as the only hospital in our district. Therefore, we have to work aggressively to recruit staff so that we can continue to deliver quality health care to the residents and visitors of the Virgin Islands. We're hopeful that our recruitment and retention strategies will bring us closer to having a full complement of staff and to achieve a greater work-life balance for our staff. At Schneider Regional Medical Center, we continuously maintain and monitor our quality and performance. The Quality and Performance Improvement Department at SRMC works hard to monitor our accreditation and regulatory compliance, our infection control and prevention practices, our patient safety, our core measures, our patient experience, and our emergency management services. Despite SRMC's staffing challenges, SRMC remains in full compliance with its accreditation and certification for the Roy Lester Schneider Hospital, the Myra Keating Smith Community Health Center, the laboratory, the radiology department, and the hemodialysis chronic outpatient unit, with the Joint Commission, the Centers for Medicare and Medicaid Services, the Nuclear Regulatory Commission, and the Food and Drug Administration. SRMC currently meets or exceeds industry benchmarks in the following domains. Response of hospital staff, we score in the 83rd percentile. Communication with doctors, we score in the 84th percentile. And hospital environment, we score in the 68th percentile. We want to acknowledge our hemodialysis team, who the Quality Insights Renal Network recently recognized for successfully demonstrating active engagement of patients and family members. This recognition was awarded within the past year. Because of our dedicated physicians and staff's adherence to infection control best practices, SRMC is pleased to inform this committee that there have been 0 work-related COVID-19 transmissions and 0 patient hospital-associated COVID-19 transmissions in 2020 and in 2021. Unfortunately, we did have 2 patients experience COVID-19 hospital-associated infections this year, but both recovered. SRMC recognizes that one of our most significant challenges is our emergency room. Our emergency department saw up to 20,000 visits the year before the pandemic and continues to have very high volumes. At times, we recognize that we do have substantial bottlenecks regarding patient flow, and we've recognized that hiring a registered nurse who will be dedicated to admissions and discharges will help to facilitate the timely movement of patients within the organization, and we're actively recruiting for that position. We continue to work to optimize all of our ER processes and to create an improved patient care experience. And making progress with discharging some of the boarders will relieve some space on our inpatient units, allow us to move patients up from the emergency department to the inpatient units sooner, which will also help with the emergency department throughput and flow. SRMC is in the open window for an unannounced accreditation survey from the Joint Commission, which means they can arrive any day. We remain focused on our quality and regulatory compliance. At SRMC, we're launching new marketing and community engagement initiatives. Every day, we show up at SRMC knowing that we will do something to improve the lives of people in this community. This focus on purpose keeps us united as a team and very committed to our work. We do excellent work at SRMC, and we have many dedicated, talented professionals ready to care for you and your loved ones should you need us. We recognize that we need to do more to communicate our good news, our success stories, the exceptional services that we offer, and the benefits of becoming a team member at SRMC. To that extent, we have increased our marketing and advertising efforts. Marketing and advertising services are expensive, and as a hospital, at times, we've prioritized patient care services above our marketing needs. However, to strengthen our recruitment efforts and to promote our services, we have now implemented several cost-effective marketing strategies that include using our social media platforms, websites, and other professional print and digital media to talk about SRMC. We've also increased community engagement activities. For example, in February, we held the first Myra Keating Smith Community Health Center Health Fair on St. John, which had a great turnout and was really appreciated by the community. SRMC staff was also actively recruiting this year for the first time ever during the Virgin Islands 70th Carnival celebration. We recently held a business after hours event where we introduced some of our new branding materials and discussed critical and unique specialty services that are available at SRMC, including perinatology, neonatology, pediatric cardiology, and a wide variety of non-invasive surgeries. All of those performed by our board-certified physicians and surgeons. Later this week, we'll be hosting Dinner with a Doctor, which is part of an exciting community educational series, as this event will discuss the pediatric cardiology program at SRMC's Heart and Lung Center. We're also starting an innovative radio-based preventative health program called An Apple a Day. This program will involve a weekly series of public service announcements intended to inform Virgin Islanders on various health topics and conditions, when to seek medical assistance, and how to avoid certain health hazards. We've refreshed our logos and we are updating our branding. SRMC's websites and social media pages are being updated to reflect our new look. We have been boosting our recruitment advertisements through social media and on new professional job placement sites. We're also placing ads in various publications, at airports, and in travel magazines. We have plans to partner with other agencies, including the tourism department, to explore opportunities in medical tourism. We've also met with leadership in the BVI Health Authority and hospital system to explore opportunities for partnerships, for learning and staff exchanges, and to talk about potentially providing services to their residents. To further our community engagements, we're also happy to announce that we've recently restarted our SRMC Foundation with an excellent board of community leaders. The SRMC Foundation will help to support the hospital in taking care of our community by funding much needed capital equipment and critical healthcare projects, which will benefit us all. This is our community with our loved ones, neighbors, and friends. Any of us may need the services of SRMC at any point, even to be stabilized before we can be flown out. Therefore, it's in our collective best interest to work together to make our hospital the best it can be. We continue to work collaboratively with the team at the Juan F. Louis Hospital to find cost efficiencies in purchases that we must both make, such as the consultants required for the Meditech expense upgrade. We are committed to standardizing our practices with JFL where possible, and we're committed to supporting the exchange of patient data as approved and authorized with JFL to improve healthcare for all residents of the territory. With the implementation of the Meditech expanse, Both hospitals will be able to share their patients' full EMR with the patient's permission. SRMC is also committed to supporting JFL's oxygen needs as requested. CEO Doug Cook and I have developed a very good relationship, and we are working together in all ways that we can for the betterment of both hospitals. We thank the Virgin Islands National Guard personnel, including 3 RNs, 2 LPNs, 8 PCTs, 4 administrative assistants, and 1 mental health assistant, who rotated and trained at SRMC from June 18th to June 30th of this year. We were happy to host the National Guard team on our nursing care units, in our case management department, in performance improvement, on the behavioral health unit, and in human resources and the business office. We are excited about our direction, and we hope that you remain engaged, encouraged, and willing to continue to partner with us to improve healthcare for our territory. At SRMC, we're pushing technology upgrades. We're aggressively working towards advancing our IT projects. We were recently awarded a grant after applying for it from the Office of the Interior for $294,000 to support hardware and software purchases, which will help us to expand our telehealth services. New telehealth programming will allow us to engage with providers on the U.S. mainland to provide services to our patient population that they may otherwise have had to travel off-island to receive. This technology will also allow us to increase our service offerings at the Myra Keating Smith Community Health Center by connecting MKS-CHC with RLSH Main Hospital virtually. We're working to upgrade our Meditech electronic health record system, as you've heard me mention throughout the testimony, to the Meditech Expanse version. The electronic health record system touches every unit within our hospital. And moving to the new version of Meditech will enable us to enhance clinical decision-making and will help us to document and bill more efficiently. There are 3 essential components to achieving the upgrade to Meditech Expanse. The first is software, the second is hardware, and lastly, consulting. The software to upgrade cost $600,000, of which $500,000 was paid by a grant funded through the Department of Health. The hardware costs approximately $900,000, and we use the money appropriated by this body in Act 8473 to pay for the hardware, and we thank you. The hardware contract has been executed, the equipment is being produced, and we expect to have all of the equipment on site in-house before the end of September of this year. SRMC is currently upfitting 2 existing rooms at the RLSH in preparation for receiving this new hardware, which is required for Meditech Expanse. The consulting work that's needed for the implementation, or the third component of this project, is projected to cost SRMC approximately $2 million. We again want to thank Governor Bryan for allocating the $2 million to each hospital as part of the $10 million of ARPA funding that was allocated. This money will cover the required consulting work costs for the upgrade. We used a joint public solicitation process to select the technical consultants in collaboration with JFL. The contract for the consulting work is now being drafted, and we're happy to report that we will have cost savings by approaching this as a joint solicitation with JFL. We plan for our project to begin in September. SRMC uses Omnicell lockers as our automatic dispensing cabinets. These automatic dispensing cabinets give nurses access to drugs on each patient care unit, and they allow for more accurate and timely recording of charges for more accurate coding and billing. They are also essential to patient safety on the units. Our Omnicell lockers are critically important, and the ones we currently have are end of life, and they need to be replaced as soon as possible. The Omnicell locker replacement is a $2 million project. We used $497,000 from Act 8473 for the first installment payment. We need to identify an additional $1.5 million to complete this critical equipment purchase. SRMC is enhancing our IT infrastructure by adding and upgrading switches and access points throughout the facility to accommodate faster speeds. We partnered with VINGN to upgrade our internet service to be 5 times faster than it was last year for the same monthly cost. We are working with VINGN to make Wi-Fi available for free in our parking lots. These faster speeds will support new services and offerings, including telehealth, remote patient monitoring, our infusion pumps, and some of our other outpatient services. SRMC has been working very closely with the Office of the Governor's Office of Health Information Technology, or OHIT, in the initial phases of creating a Health Information Exchange, otherwise known as HIE, for the territory. We participated with the Office of Health Information Technology in the first Digital IT Summit. We look forward to continuing to work with that office in the development of the Health Information Exchange, which will allow patients the ability to share their entire medical record between the territory's hospitals and with providers of their choice, and also with off-island institutions, should they so choose. This is an important step in creating a more cohesive and collaborative patient experience for Virgin Islanders. The Myra Keating Smith Community Health Center is about to enter the final phase of its IT project, which is taking them from documenting on paper records to becoming a completely electronic system. Organization-wide, we're working to create a digital front door to allow patients to do more self-service at their convenience, which will improve the customer service. It will also allow the patient and our providers to track and maintain the patient's health status in real time when they use patient wearables. This will help to streamline the patient consumer journey. It will help to address gaps in health equity, and it will create cost savings by becoming more efficient and requiring less human capital. We continue to work on enhancing our facilities and infrastructure at SRMC. Facilities infrastructure enhancements is one of our main strategic focus areas for SRMC for this year. We have successfully done the necessary repairs to our facility to continue providing services since the hurricanes of 2017. We are currently working on and planning for several necessary facility projects. This will help the organization to continue its operations, to meet the needs of the community, and to provide the public with care in a safe environment. We're in the process currently of contracting for additional roof repairs to reseal the roof of RLSH due to damages we sustained in 2017. We hope to pay for these repairs with funds that have been set aside with the Public Finance Authority. We have also completed a 5th floor mold remediation project. This was due to infiltrations in the roof due to the leaks and the need to reseal the roof. No patients or staff were impacted directly by this, as it was not within a patient care unit, but we have to ensure and want to ensure that we have a safe environment at our facility. Completing the roof repairs will help us to prevent reoccurrences. We are currently working to expand our hemodialysis unit, as we know there's increased demand for this service in the community. We're working to add 4 additional stations to better serve the community's needs. In our radiology department, we are working on removing old equipment and installing a new X-ray machine, including a new backup UPS system. With the installation of a new digital X-ray machine, the organization will be able to retire the current system, which has been in service for over 20 years. The new system will provide clearer and more accurate images, which will be a better diagnostic tool for our providers and will result in better care for our patients. In our laboratory, we are expanding and repurposing the physical space by converting current office space into a new registration area and waiting room area, and we are relocating the cytology room. Both the registration area and the new histology areas are already 75% completed. This will create a more user-friendly experience for patients who come to SRMC for lab services. All of this work is being completed by our facilities management team, who did the lighting, the tiles, the paint, and the AC ventilation in-house at a cost saving to the organization versus using outside contractors. We commend them for their work on this project. Our goal is to solidify Schneider Regional Medical Center as the community's primary choice for laboratory services in the St. Thomas St. John district. SRMC has already received agreements from the St. Thomas Office of Veteran Affairs and several community medical providers to start using SRMC's lab services when the expansion projects are completed. The build out of an enclosure for and the installation of an oxygen generator was a major accomplishment for SRMC. We utilize liquid oxygen for short intervals whenever the system is offline and as a backup for hurricanes and natural disasters. But aside from that, we are generating most of our own oxygen. We see significant savings with the functioning of the oxygen generator. We have 2 final stages of the project that have to be completed, including installing a second RIC system to help us to fill tanks and to create another backup storage area that will accommodate 20 more backup tanks. We spent approximately $695,000 on liquid oxygen from January to July of 2021 and only spent $133,000 on liquid oxygen from January to July of 2022. We have received great news about the permanent rebuilding of RLSH. Rochester Schneider Hospital has been approved for a prudent replacement, and during his testimony today, Mr. Smalls will provide us with a report on this decision and on the rebuilding efforts. SRMC is working to reduce operating expenses. For FY 2022, SRMC's budgeted expenses are $86 million. And we have a projected budget expenses of $88.5 million for FY 2023. The general categories or line items within the operating expense budget includes salaries and wages, fringe benefits, supplies, other services and charges, utilities, and depreciation. We are working to reduce or control budgeted expenses in every category. First, salaries and fringe. Currently, SRMC's full-time equivalency employee count is 515. Like most hospitals, SRMC's personnel costs account for the largest portion of our operating budget. On average, approximately 64% of our staff is clinical, and 36% of our staff is non-clinical. The total credentialed medical staff is 87 members, of which 48 are employed by SRMC. Salaries and wages expenses for FY 2023 are budgeted at $42.6 million. This represents 46% of our total operating expenses. Our actual expenses in this category in FY 2021 were $39.8 million and are budgeted for FY 2022 at $41.6 million. Our biweekly payroll is approximately $2 million currently. That includes salary and benefits. Overtime costs are currently $92,000 approximately per pay period for this fiscal year. Some of this overtime is inevitable due to staffing shortages, but we have been monitoring overtime costs and we have set new policies to help to reduce overtime. We reserved and planned for agency staffing costs of $6 million in this year's budget. Again, getting to be fully staffed by permanent registered nurses is our goal. Even though we're challenged by the current pay schedule and the national shortage of RNs, to the extent we can increase our number of permanent RNs, we will be able to reduce what we spend on agency staffing. We're working to pay the $116,000 in retro that we owe to SIU as soon as possible. We are happy to report, though, that we are current with all of our other 8 unions in terms of retro payments. Additionally, the organization is working to complete a FEMA worksheet, which may help with the reimbursement of costs associated with acquiring the contract nurses and allied health professionals we have gotten in the wake of COVID. This will be similar to the one that DOH has in place for Pafford staffing. We're hoping to be able to recoup some of the cost of the contract or agency staff expenses that were related to COVID. Our fringe benefits for FY 2023 are budgeted at $14.5 million, which represents 16% of our operating expenses. Fringe benefits for 2021 were $14.4 million, and they're budgeted for FY22 at $14 million. SRMC continues to struggle with covering the increased costs of the employer portion for health and retirement benefits with GERS. The employer cost of benefits is currently at $14.5 million, which compared to the total wages and salary expense of $42.6 million shows that SRMC has a benefits expense rate of 34%, which is high. We're also working to reduce expenditures on supplies and equipment. Supplies are budgeted at $13 million, which represents 14% of our total operating expenses. Medical supplies represent the largest portion of that expenditure subgroup at $4 million. On May 1st, 2022, SRMC joined a new group purchasing organization, also known as a GPO, called CHC Supply Trust. By partnering with CHC, SRMC has recognized and benefited from immediate savings in its supply costs through CHC's national purchasing power. With SRMC continuing to be committed to being fiscally responsible and seeking out new partnerships like CHC, the organization may see an annual savings of up to $1 million of its supply spend. Food, drugs, and other medical and non-medical supply costs do continue to increase nationwide, which presents a challenge in controlling and reducing costs, but we continue to review our inventory procedures to ensure there is efficiency and to reduce costs where we can. In FY 2021, SRMC conducted a fixed asset inventory project, which helped to locate and track all of our major equipment. This helped SRMC identify its true equipment needs and avoid duplication in purchases. It also helps us to accurately track equipment and inventory from a financial reporting perspective. We work to control utility expenses at SRMC. Utility expenses for SRMC are budgeted at $4.2 million in FY 2023, which represents 5% of our total operating expenses. SRMC's average monthly invoice from WAPA is $350,000. Our current outstanding payable to WAPA is $1.7 million. We pay WAPA $275,000 monthly as a direct allocation from our budget. SRMC also pays the WAPA bill and maintains the AC and other mechanical systems for the portion of the Royal Schneider Hospital building that DOH occupies, which is approximately 15,344 square feet. SRMC wants to work at pursuing accounts receivable, specifically from other government entities. SRMC is owed money by other government agencies and has been unsuccessful in collecting on some of these bills. Currently, Workman's Comp owes Schneider Regional Medical Center $3.7 million. The Bureau of Corrections owes approximately $693,000 to SRMC. The Department of Health currently owes approximately $234,000 to SRMC. The Department of Human Services owes in excess of $130,000 to SRMC. And the Department of Education owes SRMC $7,500. There's also a significant amount of money owed to the hospital by Medicaid due to claims not crossing over and therefore not being processed and paid. The payment of these funds would be a major help to SRMC. We're working to catch up with our GERS payments. SRMC has had to make hard choices regarding funding acute care services and meeting our other AP obligations. Consequently, we had a 2-month arrearage in our GERS payments. While we did fall off of paying GERS for a brief period, we have since resumed making payments, and we are paying for current months. We've begun to catch up also on the payments that we owe. We still owe only a balance of 2 months where we missed payments, which totals $1.4 million. We have planned to set aside funds through the remainder of this fiscal year to catch up on what we owe and to bring our account current with a zero balance by the end of September of 2022. We understand and genuinely regret that this has affected the processing of retirement benefits for 2 recently retired staff members, and we are working to rectify that as soon as possible, but definitely at the latest by the end of September 2022. We're working to maintain vendor relationships despite a growing AP. So SRMC's accounts payable, or AP, has grown significantly over the past fiscal year. SRMC's AP is currently at $22 million, compared to $15.8 million on September 30th of 2021. The growth in SRMC's AP is specifically and directly attributable to our reliance on temporary contract labor to support mandatory patient care, including contract staff nurses, contract advanced practice nurses, contract allied health professionals, especially for the laboratory, and locum tenens temporary staff physicians. These staffing agencies require prepay and or prompt pay, and it's affecting our ability to pay our other critical vendors. These expenses have led to SRMC's overall expenses exceeding our revenues. Other market variables such as runaway inflation, the high cost of imported materials and supplies, and vendor demands for upfront payments have also come into play over the past 12 months. These have had a tremendous impact on SRMC's accounts payable and on our cash position. The financial condition has affected our vendor relationships and our ability to procure other much needed supplies on time. We are working to maintain those vendor relationships and repair them as we can. We're renegotiating contracts and handling legal matters that are active. Our Office of Legal Counsel works with our procurement director to host a contracts committee, which is working diligently to streamline our contracting processes, to increase the tracking of our agreements, to improve our reporting on vendor performance, and to advocate for the best possible terms for the organization to help our bottom line. We're reducing our contract costs by bringing certain services in-house where we can, such as landscaping and electrical services. SRMC engages external vendors across almost all departments of the organization for the continuity of operations. Presently, SRMC supports 143 active contracts, including three projects that the Territorial Hospital Redevelopment Team manages. 40 of our agreements are fee-based, and over half of those 40 are with staffing agencies. This highlights the extent to which our operating costs can fluctuate when we have significant reliance on temporary and agency staffing to support the daily operations. We presently have 27 preventative maintenance agreements in place, including regular maintenance of our radiology equipment, elevators, fire alarms, and kitchen facilities equipment. For FY 2022 so far, we have spent over $1.5 million on preventive maintenance services. The Office of Legal Counsel and Compliance continues to work collaboratively with the Department of Justice on active matters before the Supreme Court of the Virgin Islands and the District Court of the Virgin Islands. SRMC has cases in all phases of litigation, including one case with a judgment to be satisfied. We recognize the need to satisfy this demand as soon as possible. I'd now like to provide this committee with some updates for Myra Keating-Smith, CKCI, and the Behavioral Health Unit. Our Myra Keating-Smith Community Health Center is the only 24-hour ambulatory care center on the island of St. John. Services offered at MKS CHC include family medicine, urgent care, emergency care, radiology services, laboratory services, and nutritional counseling. MKS CHC coordinates care for inpatient services for its patients with the Royal Leicester Schneider Hospital on St. Thomas. The two facilities are linked electronically to provide and improve efficiency in patient care services and billing and collections. Expanding our connectivity to include telehealth technology and services, as mentioned earlier, is going to make that connection even stronger. For FY 2022, Myra Keating Smith had conducted 5,013 provider visits, which puts it on track to surpass our FY 2021 patient visit number, which was 6,372 provider visits. Our staff at Myra Keating Smith is comprised of 5 security officers, 5 full-time RNs, 2 Pafford RNs, 1 phlebotomist, a unit secretary, a cashier, a medical records representative, a hospital account manager, a radiology technician, 2 physicians, 1 head nurse, and 1 administrator. We currently have vacancies at Myra Keating Smith for registered nurses, for a nurse practitioner, a medical technologist, a patient access representative, a driver, and a security guard. We encourage interested persons to apply with Schneider and Myra Keating Smith to fill these vacancies. Over the years, we have received multiple requests to install a hemodialysis unit at Myra Keating Smith Community Health Center. We have given this matter much consideration. Installing a hemodialysis unit at MKS requires plumbing and a reverse osmosis system be installed there. We would also need to have a room specifically dedicated to this service, and we'd need to have staff members specifically trained to mix acid. It would require hiring and training RNs, hemodialysis technicians, and a Crown Web extractor for St. John. It would also require us onboarding an additional biomedical technician to support the services there and the purchase of the additional required stations and associated equipment and supplies. It would be a very large investment, and given the limited number of patients that need it, which currently stands at 0 patients on St. John, it's not practical at the present time. We're also aware of the community's request to have the option for live births on St. John, but there are major difficulties with doing that. Our concerns are many. Myra Keating Smith Community Health Center does not have a midwife on staff, and the 2 RNs per shift at MKS are not labor and delivery nurses or nursery nurses. The physicians at MKS CHC are not OB/GYN physicians. If there are complications, there is no option for C-sections at Myra Keating Smith. Allowing births at Myra Keating Smith Community Health Center would be a major safety and liability issue. In the past, when there were deliveries on St. John, mommy and baby were immediately sent to RLSH for further evaluation and care. Further, at night, even though we do have a physician on call, we typically only have 2 nurses and a security guard at the clinic. And if there are other patients at the clinic during the time a laboring mother comes in, there would be no one available to care for and monitor the mother and newborn and the other patients at Myra Keating Smith. Myra Keating Smith, however, will continue to expand other women's health services over the coming fiscal year, and our team at Myra Keating Smith works hard to continue to provide reliable, quality care to the St. John community, and we thank them for their commitment. The Charlotte Kimmelman Cancer Institute, which is tremendously important to the Virgin Islands, remains closed to the public currently. However, significant progress has been made towards its renovation and modernization. We are happy to report that FEMA has obligated $50 million for the reconstruction of the Charlotte Kimmelman Cancer Institute, which is expected to proceed at a substantial pace in FY 2023. Mr. Darrell Smalls, the Executive Director of the Territorial Hospital Redevelopment Team, or THRT, will provide additional details about this rebuilding project during his testimony. All of us at SRMC look forward to restoring much-needed cancer care treatment and services at CKCI, including radiation therapy. SRMC operates a behavioral health unit. SRMC's behavioral health unit has 6 staffed inpatient beds, and we typically have a census of 6 inpatients. SRMC spends approximately $4 million annually on staffing, supplies, and other fixed costs to operate our behavioral health unit for inpatients, and we spend an additional $2.3 million annually to provide stabilization care and treatment to persons with behavioral health issues in our emergency department. We had 293 patients admitted to our behavioral health unit in FY 2020, and 395 patients admitted in FY 2021 to our behavioral health unit. And we've had more than 215 patients with behavioral health issues admitted to the unit so far in FY 2022. SRMC maintains care for persons with COVID in the community, and we have a highly infectious disease unit with inpatient beds capable of providing care to persons with COVID, with monkeypox, should that come here, and for any other highly infectious diseases. We are glad to see that the incidence of COVID has gone down in our community, but we know that it's still present, and unfortunately, we still continue to have fewer, but still have deaths due to COVID. We want to thank our staff for their care of COVID and other patients with highly infectious diseases. I'd like to provide a brief update on our hurricane and natural disaster preparations. SRMC is prepared for this year's hurricane season and for all other potential natural disasters. SRMC received a grant through VITEMA that covers ham radios, satellite phones, laptops, digital cameras for documentation purposes, and external IT access points to assist us in the event of a natural disaster. Our staff are trained to operate the patient tracking software, which has been provided by the Department of Human Services. We also participate in JPATS and Pulse trainings, which we will use to track patients on island and off island in the event of a disaster. SRMC participates in the Emergency Support Function number 8, or ESF 8. We will ensure the continuity of care to patients in the facility during and after natural disasters. We work with our colleagues in ESF 8 to assess public health and medical needs, to do health surveillance, to activate medical care personnel, to perform patient evacuations and care, and to ensure the safety and security of drugs, biologics, medical devices, food, and blood products during a natural disaster. Our IT department is preparing for any potential disaster by seeking a disaster recovery solution to back up and restore any data that is lost or any systems that are damaged in the event of a disaster. We have issued an RFP to identify a vendor to provide a cloud-based solution to back up all of our data in the event we lose our in-house servers. All of SRMC's data will be backed up, and our operations will have minimal interruption. This project is expected to cost approximately $500,000 over 5 years. In conclusion, SRMC is working diligently to build the community's trust in the care we provide and to retain and attract staff. We are engaging the community on all platforms, in radio, in print, and in social media, to promote the Royal Leicester Schneider Hospital and the Myra Keating Smith Community Health Center. We are working to improve our operations and productivity and to create an attractive environment with competitive salaries in all practice areas. The budget presented today is conservative. We are committed to being more aggressive in our own billing and collections efforts and more innovative in generating additional revenue and controlling expenses. Although there are challenges in the local and national landscape as we outlined today, SRMC continues to provide high-quality care to our community. We will continue to improve and enhance our physical infrastructure and our IT infrastructure, and we will continue to work on ways to ensure the delivery of services to our community is more efficient. Our progress would be impossible without our dedicated and skilled staff. I genuinely thank my executive team, our entire clinical and support team, and all employees of the Schneider Regional Medical Center for their commitment to providing quality, reliable healthcare to this community. I'd like to say thank you to this committee and to the entire legislature for your support and for this opportunity to present our budget and to provide an update on Schneider Regional Medical Center. In closing, I'd also like to thank Governor Bryan and his administration for the ongoing support for our healthcare system and our hospital. Our team looks forward to working collaboratively with all of you and with the community to ensure that Schneider Regional Medical Center is the best it can be. The senior leadership team and I are available to answer any questions you may have. Thank you very much.
Thank you for your testimony. We'll next go to Mr. Smalls.
Good morning, Honorable Senator Kurt A. Viele, Chairman, Committee of Finance of the 34th Legislature, and Honorable Senators of the Committee on Finance, other Honorable Senators of the 34th Legislature, Senate staff, fellow hospital testifiers, and the listening and viewing audience. My name is Darrell A. Smalls, Executive Director of Facilities and Capital Development for the Territorial Hospital Redevelopment Team, which I serve under the leadership of Chairman Christopher E. Finch of the Virgin Islands Government Hospital and Health Facilities Corporation, also referred to as the Territorial Hospital Board. As the Executive Director of the THRT, my primary role is to manage and oversee the planning, programmatic design, final design, bidding, project management, construction, procurement, and closeout of the redevelopment of the Juan F. Louis Hospital, the Roy L. Schneider Hospital, the Charlotte Kimmelman Cancer Institute, and the Myra Keating Smith Community Health Center. As I recently presented before this body on July 22nd, 2022, in conjunction with the Juan F. Louis Hospital during their fiscal 23 budget, the THRT assumed the oversight responsibility for completing our hospital facilities in collaboration with the leadership of SRMC, the Office of Disaster Recovery, our disaster recovery consultants, Witt O'Brien, to ensure we develop complete and comprehensive projects that are self-sustaining and uninterrupted, while each facility in the interim continues to provide quality health care to the residents of the Virgin Islands. Specifically here in the St. Thomas St. John District, our objective is to renovate and reconstruct CKCI, construct a new MKS, as well as to construct a new RLSH. While this is indeed an extraordinary undertaking, my team and I remain undeterred with the task with which we have been given. With respect to the Charlotte Kimmelman Cancer Institute, we recently received notification on June 27, 2022, from FEMA of an award of just over $50 million for the reconstruction effort of the facility. This award will facilitate the immediate rebuilding of the hurricane-damaged CKCI to enable SRMC to once again provide the vitally important and much-needed cancer care in the Virgin Islands, which includes chemotherapy coupled with radiation therapy. I am pleased to report that this past Wednesday, the Government Hospitals and Health Facilities Corporation approved the recommendation of the Territorial Hospital Redevelopment Team to award a contract to J. Benton Construction to commence with the selective demolition of the Charlotte Kimmelman Cancer Institute. Once the contract is executed, which we anticipate will occur within the next 14 days, and the permits are issued within 14 days thereafter, we will issue the notice to proceed. The contractor will then immediately commence with the demolition activities, which is slated to be completed within 90 days. Simultaneous to the demolition process, the THRT, in collaboration with the Architect of Record, EYP, and the executive leadership of SRMC, has been working diligently to finalize the plans and specifications, also known as the contract construction documents. Once finalized, we will publicly advertise this most important project during the last quarter of 2022. Our preliminary schedule has construction contract issued by January 2023, with a project completion by January 2024. I want to assure our community that any opportunity to bring this schedule in closer, that the THRT will endeavor to do so. It is also important to note that the THRT has already issued an RFP for the acquisition of the major long lead equipment utilized within the operations of CKCI to include both the linear accelerator and the CAT scan. This solicitation is scheduled to close on Monday, August 22nd, 2022. Once a contractor is selected, the equipment will be ordered to ensure the timely receipt, which will coincide with the completion of the reconstruction effort. The Myra Keating Smith Community Health Center on the island of St. John was initially notified by FEMA on July 1st, 2021, that pursuant to FEMA's 50% rule, the facility was eligible for replacement. While FEMA has approved the Myra Keating Smith Community Health Center for replacement, they currently incorrectly consider it to be a medical office building and not an acute care facility. As a result, FEMA is not applying the full healthcare industry standard to the replacement facility, leaving a significant shortfall in funding. We are confident that once FEMA fully acknowledges the critical healthcare functions performed at MKS, they will agree to apply all the healthcare industry standard, providing sufficient funding for the construction of a state-of-the-art facility for St. John. We are confident that we will be successful in this effort and that FEMA will reconsider their most recent determination. My team and I, along with the Widow Bryan team, will continue to persevere in this effort. On July 21st, 2022, FEMA issued notification to the territory that the Roy L. Schneider Hospital has been determined for a prudent replacement. This is great news, especially to the fact that this process of deliberation with FEMA commenced in 2018. And after many, many meetings, the THRT, ODR, and Widow Bryan worked collaboratively to persevere. I would be remiss if I did not personally thank the entire team for their dedication with ensuring we were successful with achieving this determination. Thank you to each of you for your unwavering resolve. It is deeply appreciated. The next most crucial step in this process is to establish a fixed cost offer for the new Roy L. Schneider Hospital. Similar to my recent presentation on Wang Lui, SRMC was originally constructed as a 250-bed hospital at more than 200,000 square feet. At the time of the 2017 hurricanes, RLS was licensed as a 169-bed facility. Thus, the space requirements must be revalidated, especially since the remaining rooms were never reconfigured from the original design as patient care rooms. We are confident that we will arrive at a fixed cost offer soon, which will then enable the THRT to move forward with developing the plans and specifications for the construction effort of the new facility. While we continue with this effort, we will soon commence with the programmatic effort in collaboration with the leadership team and the staff of SRMC, which will facilitate the full-scale planning and design of the new facility. This effort is currently projected to be completed within the next 12 months. One of the greatest challenges that we face with all of our present construction activities is the global supply markets. Disruptions and shortages in steel, aluminum, wood building materials, microchips, and plastic raw materials, to name a few, are all prevalent in this pandemic-driven marketplace and are not unique to any singular company, material, or channel. These disruptions and shortages are generally caused by tariffs, labor shortages, increasing demands, and consolidations in the entire supply chain. These issues are generally outside the scope of control of any vendor or supplier. We have been advised of the following matters. Specific changes in raw material lead times routinely provide little or no advance notice of a pending change. The changing lead times are not consistent, limited to a specific material, grade, and/or supplier. Attempts to pre-order larger quantities are met with further increased lead times due to the increase in demand and have been unsuccessful. The lack of notice and continuous disruption has created a challenging environment for scheduling. Each of these factors, to include the unique challenges to our territory, poses significant challenges to accurately manage a project schedule. Despite this challenge, the THRT will remain in constant communication with our vendors and will ensure that we remain transparent with our territorial board and the leadership of our hospitals, and equally important, our Virgin Islands community. As I conclude my brief project update, I want to thank the Office of Management and Budget for including the sum of $500,000 to be included in the Schneider Regional Medical Center's fiscal 23 operating budget. This funding is vitally important to support the Office of the Territorial Hospital Redevelopment Team in the St. Thomas St. John District. This funding will not only support the salaries of the dedicated employees of the THRT, but will also support the operations of the office to include supplies, resources, and eventually lease space wherein we will perform our respective oversight responsibilities. To my team, I want to publicly thank each of you for your dedication, your commitment, and your tireless efforts to this mission we have embarked upon, as well as the Territorial Board and the leadership of SRMC for your unwavering support. Thank you. This concludes my update on the status of the progress of the rebuilding efforts for the Charlotte Kimmelman Cancer Institute, the Myra Keating Smith Community Health Center, and the Roy L. Schneider Hospital. I will remain available to answer any questions at the appropriate time.
Thank you for your testimony, quite comprehensive testimony by both parties. We're going to go into 6-minute round, colleagues. The real Senator Kenneth Gittins has just joined us. Thank you. Thank you for coming. Let's begin with Senator Blyden. You recognize for 6 minutes. Senator Blyden's mic.
Thank you. Thank you so much, Mr. Chair. Good morning to my colleagues, viewing and listening audiences, staff, central staff. Good morning. CEO, Comissiong, and
Good morning, Senator.
thank you and the supporting team there with your management team. I thank you so much for the most comprehensive, in-depth presentation. I must say it's on point for sure. You have covered a lot of areas, and you addressed many of our budget questions already. But nonetheless, let me start off quickly by going to the post-audit report, and let me ask Ms. Sir, your numbers person. What's your name, sir, again? Mayor?
Stephen Mayers.
Mayors. Good morning, sir. In respect to the post-audit report, it stated that there were no personnel listings submitted, no vehicle listing, no outstanding vendor payments, and no federal grants were submitted. Have you submitted those since this was submitted to the post-auditor? I mean, I've seen many of the information in the testimony, but have it been submitted to the post-audit department?
Good afternoon. Oh, sorry, still morning. Good morning, Senator. I will follow up on that. I think we did, but I would have to follow up and make sure that it has been done.
Please, that's important. Okay. But I know as far as the testimony, though, when it comes to that most in-depth testimony page, let's start with page 12. Let's go to page 12 of the testimony. CEO, you mentioned in the testimony the 55 victims of gunshots, the $1.6 million that's charged to the hospital that's affecting you in a negative manner. Is there anything that can be done in terms of those individuals when it comes to screening, whereas we can find out exactly if they have some type of insurance, anything to assist your department?
Yes, Senator, CEO Comissiong. We are working to see that we can get as many persons who present for care, including gunshot victims, enrolled in presumptive eligibility if they don't have any insurance, but we work with them and their family members as they present to investigate whether they have insurance. And if they do, we definitely want to process the insurance because, as mentioned in the testimony, the care can be quite expensive when we do get a victim of gun violence, unfortunately.
And folks need to know that because it does affect the hospital, and all of us are the result of that in many other ways. Also, you spoke to your gross monthly patient billing, which averages now $10 to $12 million. What the max in terms of revenues when it comes to billing? What the max? I know you average 10 to 12, but what the max in terms of that respected area?
Yes, Senator, and thank you for the question. I think some months we do slightly exceed the 12 million. We want to push to continue to grow our volumes and increase our services, thereby being able to do more gross billing and by that collect more revenue for the organization. I know that in the coming year we have plans for service expansion and we have plans to increase our billing and collecting activities. So I think we will continue to see that gross number increase over the next year.
What the number though in terms of gross revenues, what that number look like? I know you collect 10 to 12, what that number?
Gross revenue right now tends to hover between the 10 to 12 million dollars a month, but I think there are some months where we've gotten to 13 million. I can defer to Mr. Mayers to weigh in if he has specific numbers for other months, if you'd like, sir.
No, what I'm trying to get to, I mean, in terms of, I know you average 10 to 12, but what for instance, if there's $20 million I can get on a monthly basis based on whatever, but I average 10 to 12, what that maximum number, I just want to know what that number looks like, basically.
We might be able to grow to 13 to 14 million, Senator, per month in terms of gross billing, sir.
And you spoke to your number one challenge, shortage of nurses. You say, you mentioned, I think 160 will be the number you'd like to see in terms of the amount of nurses and other related staff when it comes to a well-run hospital, but the challenges like everywhere else in terms of recruitment, salaries. You spoke to the challenges in terms of salaries, the GRS, etc. Let me ask you, and also with the graduates, because I know you said I think some 22 graduated and you got 2. Do we know exactly in respect to the nursing program at UVI? I know you got 2. We do not. It would be good to know how much went to the hospital in St. Croix and other clinics, because I know based on the bill they're supposed to be dedicated to us here before, and 2 is kind of a low number. What's going on in that space in terms of recruitment efforts?
Yes, Senator, certainly agree with you. We want to try to capture as many of the UVI School of Nursing graduates as possible. And I know JFL is also working to actively recruit the graduates out of the St. Croix campus. I know that there are more students from this year's class of 22 that are interested in joining Schneider Regional. When we met with them, we did on-the-spot interviews and just spoke with them about their experience. Many of them had done their clinical rotations at Schneider and indicated that as soon as they had completed their board exams, they wanted to come back, and not just come back to join our organization, but they wanted to come back and specifically work on the units where they had their clinical experiences, which to me suggests that the students really enjoyed their time at Schneider, enjoyed the units they worked on, and saw it as a place that they could call home in terms of their employment. In the conversations we had with the students, many of them said that they really wanted to spend this time focused on studying to be able to pass the NCLEX board exam, and so they were dedicating themselves to doing that first and then wanted to pursue employment. So I think of the 22, we will end up onboarding a significant number of them. It's just a timing factor.
But then, Mr. Chairman, may I wrap up? And by then, also you spoke to the salary, and you gave a chart in terms of examples. I believe they need to be on the same scale like California because of the cost of living here, because it's so high. And in closing, you spoke also to the challenges at the emergency room, and that's one of the most significant challenge. And you say you had so up to 20,000 a visit before a year, 20,000 a year before the pandemic. What does that number look like after the pandemic? And what are the gross or lost revenues as a result of that number? What does that 20,000 represent in terms of dollars and cents?
Yes, Senator. So to your first point about staffing, I think that's a really good observation. We recognize that cost of living is very high here, and so we know that our salaries need to be high. They probably need to be higher than the national average, but at least as high as the national average. So I think that's a very good point, sir, and thank you for that. As we look at our emergency department, we have seen the volume pretty steadily high there within the emergency department. We do generate revenue based on our emergency department visits. So it is our front door and where most people encounter our hospital, but it's also an area where we do revenue generating activities. So we have to continue to strengthen throughput, as you mentioned, and just create a better experience in the emergency department for persons in our community who come to us for care.
Thank you so much. Thank you, Mr. Chair.
Thank you, Senator Blyden. We did not get the outstanding vendor payments. So if you can have someone from your office, email it to Post Audit Now, and they'll send it to each senator. So if someone is back at the office, have them email it to us now. That's an important category that we need to know.
Yes, sir. We'll do that immediately. Thank you.
Okay. Senator Bulquist, you're recognized. Oh, before I go to Senator Bulquist, all the graduates from UVI, were they offered a position? Do you have a graduate nursing program?
So we have a program to employ the graduates of the School of Nursing as soon as they are completed their program and they're ready to onboard. They can even onboard. We've onboarded some as PCTs before they have graduated. So there is a hiring opportunity. We went to the graduation ceremony, spoke with the nurses there, the nurse graduates, and then invited them to all come on site for a breakfast that we hosted with all the graduates, where we offered all of them employment. We sat down and we had our nursing leadership team there to do one-on-one meetings and interviews and talk with them about what life is like as a nurse.
Just wanted to make sure that was done, and just
Yes,
put
sir.
in a word out there that those students who are receiving the nursing scholarship from the Board of Education, there is an obligation that you have to serve in the Virgin Islands after receiving $10,000 per year. So we have to, well, the board is coming before us tomorrow, and that is some crucial information that we need to find out as to whether or not those individuals that have received a scholarship from the government of the Virgin Islands, as to whether or not they are remaining in the Virgin Islands or they're moving to the mainland. And the way it works, if you move to the mainland, then you have to pay back the scholarship that was given to you. Senator Carla Joseph, welcome. Senator Alma Francis Heilager, welcome. Is it relevant? Go ahead. Point of inquiry. Senator Carla Joseph, Mike.
Thank you kindly. Pleasant good day, everyone, to our listening and viewing audience. Mr. Chairman, my point of inquiry is to piggyback on your questions regarding the scholarships and your outreach and retention. I noted that you mentioned the Ralph O. Wheatley Skills Center, but it was focused mostly on the LPNs. What are you doing as far as recruitment for the CNAs and CMAs for the Schneider Regional? Because I noted in your testimony those two categories were absent.
Thank you. Thank you, Senator Joseph. We do also work to get other trained clinical professionals through the Raphael Wheatley Skills Center. So we work with them to get medical assistants, folks who are trained in billing and medical front office work. So we get a variety of persons that we engage with through the Raphael Wheatley Skills Center. Additionally, we do get CNAs who are grown locally. And then to supplement that, we've started our own patient care assistant training program at Schneider to help to develop the pool of persons that are available to help the registered nurses and other nurses on the floor. And we mentioned a little bit the LPNs that we're happy to onboard, as they really are a great complement to our registered nurses on our units.
Thank you so much. Senator Bulquist, you're recognized.
Thank you, Mr. Chair. Greetings and salutations to everyone. Good morning, Executive Director, Comissiong, and Administrative team of the Schneider Regional Medical Center. I would like to begin by congratulating you for expanding your services in pediatric cardiology and bringing on board Dr. Robert Voigt-Lowell, an important step to further service our population and its most important investment, our children. I'd also like to congratulate you for applying the oxygen generator about 1.5 years ago, I believe, which has obviously brought you considerable savings. I see at least about $165,000 based on the post auditor's report between fiscal years. Yes. So I'd like to congratulate you for that as well.
Thank you.
Another thing, after congratulations, sometimes things go south.
That's okay.
So there are some issues that I would like to bring to your attention,
sure.
And particularly concerning Myra Keating on St. John. Some of the timelines on dates and times on the services provided, based on what I'm seeing on the post auditor's report and also on the testimony, don't seem to correlate with what I know to be the present situation on St. John. I'm hoping that someone could please clarify that for me.
Sure, Senator, happy to do that. And good morning to you also, Senator Bouklas. How can you provide a little bit more information about the question about what services you'd like us to discuss?
Sure. What I know the current situation to be is individuals cannot have access to X-rays on St. John 24 hours a day. There's also issues with setting up appointments. You have to call in advance for an appointment. I'm also aware of the walk-in procedure. I'd like some more information on that because I'm hearing mixed stories from people on the ground concerning the walk-in procedure.
Sure, I can start by addressing what you've brought up, Senator Bouklas. So Myra Keating Smith functions as the only 24-hour center on St. John offering health care. What we do is at Myra Keating Smith is a combined service offering. So we do urgent care 24 hours a day. If you have an accident or injury or trauma on St. John, you can either drive yourself to the clinic or come via ambulance to the clinic where you will receive that stabilizing care and sometimes be transported to St. Thomas. Sometimes, depending on the injury or the nature of the injury, EMS will bring you straight via EMS boat to Schneider Hospital. But many times you stop in St. John at Myra Keating Smith and are treated there. So that urgent care is available 24/7. We also do clinic work in St. John at Myra Keating Smith. So things like women's health exams, things like routine labs, things like routine visits. The Myra Keating Smith Center is very unique in that it offers both, and it's really a great thing for the community on St. John. So for those types of visits, you do have to have an appointment, and you would call and you would have to call and speak with them now to schedule that appointment.
So if I might say, in an emergency situation, I'm hearing different ways of how an individual will be intaken.
Correct.
So I'm just very concerned about, because we recently had a number of deaths on St. John, and one of them particularly came across to me, and I'm trying not to bring up a whole personal thing here on the floor today.
Sure.
But maybe we can get into a back-end discussion about that. With the birthing center, that's close to my heart, and I think it's close to everyone on St. John's heart, because I'm of the particular belief that St. Johnians are becoming extinct. Mm-hmm. And I believe that we really need to see what we can do to make that a possibility. Mm-hmm. It is a right of every person in this territory to have access to good health care and also have their children birthed. So I really want to see what we can do. Is there any feasibility report or any sort of information that you have on your side concerning the cost associated with a birthing center on St. John?
Yes, Senator Bouklas. So it would actually, as someone outlined in the testimony, require a significant investment to be able to offer live births on St. John. We may think the birthing process, and it may start out as a completely safe, totally scheduled, everything going great birth, and in the middle of it, in 20 seconds, turn completely different and become an emergency situation where you need highly trained surgeons, like OBGYN physicians to actually start a C-section. You need a neonatologist afterwards or a pediatrician afterwards to immediately tend to the baby when it comes out. So those things require a total team and specialized equipment to successfully and safely handle. And we don't want to put anybody in jeopardy.
Understood.
Yes, sir.
But what I'm trying to get at is, what is the cost associated with potentially having a birthing center on St. John? Do you have those numbers? Have you done a feasibility report to see what the possibility is?
Offhand, I would estimate it would probably be the tune of at least $1 million a year. And even at that, you still can't ensure the most safe situation, I don't think, for the mother or the baby. And so maybe we can look at other ways creatively as a territory to say, if your parents live in St. John and you're immediately born and you go back to St. John, maybe you get a designation of St. John as your birthplace on your certificate. I mean, I don't know if that's possible. It's something we can explore so that we ensure we safely deliver mothers and babies.
We can sit here and hit the ball from one side to the next side and talk about how dangerous it can be for a woman to travel from St. John to St. Thomas on an ambulance boat, et cetera.
Sure.
But I think that we really need to do our due diligence to really see what the possibility is. It is a right for the people of St. John. Let's do our best to make sure that we cover all the bases to make sure that we can see that possibility manifest itself.
Time.
So thank you for...
Certainly, sir. And I don't think it's impossible. It's certainly something that we can continue to explore. If there was some donor with funding, or some way to fund it, it's certainly something we can continue to look at and explore. And so we're happy to do that. And thanks for the question.
You're welcome. Thank you, Mr. Chair.
Thank you, Senator Bolkos. The Committee of Finance will take a 2-minute recess. The Committee of Finance is back on the record. Senator DeGraff, you recognize.
Thank you, Mr. Chair. Good morning, colleagues. Good morning, testifiers, all viewing, listening, and present. Executive Director, is your first in this capacity?
Yes, sir. My first budget testimony.
So I
as
gonna let you
CEO.
know, I got your back. I support you and the hospital 100%.
Thank you so much, Senator
Okay.
DeGraff.
So basically, all the money you need, I ready to sign off and give it to you.
Awesome. Thank you so much for your
good.
support.
So that's where you're gonna start.
Tina
And-
Comissiong,
and-
CEO.
and I say that because you know, in regards to what the previous senator spoke in regards to St. John, in the 32nd legislature, I put in a legislation to have a maternity ward on St. John, because in the Virgin Islands right now, there are no more native-born St. Johnians. You know, we got St. Thomians, things. So, you know, so that's like, to me, that's like saying, if you get rid of Savannah, I gonna have a war, because you can't, they must have people from Savannah. So they must have people from St. John. So that's something we really have to look at. That's how we look at it. Now, how much money are you asking from last year budget, 22 budget to 23 budget? What? How much?
Put your name on the record, new recorder.
Okay, right. Good.
Tina Comissiong, Chief Executive Officer for Schneider Regional Medical Center. Thank you for the question, Senator DeGraff. This year, we're requesting the GVI appropriation of $28,750,000, which is the same as was requested and approved for the past fiscal year, sir.
Why? That's what get me lost. I know that you're doing the same thing. I mean, and I'll tell you why. As an interim director, for all my years as a senator, number one, you can look back and see. Number one for me is personnel. Personnel is 46% of your budget. You ain't asked for a dime more. And you here telling me you have retro to SIU. You're talking about increasing. And when I speak in this tone, there's no disrespect. So I you know.
Yes, sir.
But again, it don't add up to me to come before us to tell us what all you need money for. You have this great staff. You're trying to recruit here and there, and then you don't ask for a penny more? Wrong move. I'm going to come and school you. We're going to talk and we're going to go, okay? And give you some information.
Yes, Senator. I look forward to your advice.
But it is a wrong move. I mean, you got to tell us, you talk about increases for nurses. Yes, the salary should go up. Yes, I understand we have to find monies and different things. But I'm saying now, the nurses aren't the only entity that needs to have wage increases. How many unions do you have in the hospital?
We have 8 unions in our hospital, 9 depending if you consider
how
one
many
union has
have
2
negotiated?
parts.
So SIU already negotiated, and you say you owe them retro.
We owe them some retro, yes, Senator.
Take care of your staff first.
We always want to take care of our staff first. And I appreciate your comments, and we'd be appreciative of any additional financial support that the legislature would allot to us.
You
sir.
got to say what you want. That's what I'm telling you. You knew at it, so we understand.
Okay.
Now, retirement. You say you pay your OGRS where you have 2 persons can't collect. When I retired first, it took me 14 months before I got paid. That's wrong.
I very much agree with you, and we have to get current with GRS as soon as possible so those 2 hardworking employees who serve Schneider Regional can collect their retirement, and I'm working to ensure that it'll be less than 14 months for both of them, sir.
Yeah, so let's get our money in, let's get our figure in, add it to this 20, the same amount, add that money in to get them taken care of right away.
2 minutes.
The infrastructure that your employees are working in, old building.
Mm-hmm.
Mr. Small did miraculous work for what he's doing and continue to do that. Thank you for what you do. But again, you're working hard on old buildings. What is the status of the infrastructure for your employees? Do you have in additional monies or any monies to fix things, capital outlays to fix things presently for your employees? Do you have any money budgeted for that?
So we don't have money, Senator, for specific specifically for capital outlays, but we do have a plan to continue to do facilities improvements, and we have a very talented team of employees who work in our facilities and engineering department, led by Mr. Peter Jean-Baptiste. And we're working to do as much incrementally with our in-house staff as we can, supplementing with contractual work to the extent we can afford it and schedule that. It's something that we have to continue to do. We have to have a safe environment to care for our patients. It's part of our Joint Commission accreditation, and it's part of our commitment to serving this community.
So going forward right now, how many out of those 5 unions are going to negotiate in 23?
So of our 8 unions, we have plans to negotiate at least 4 in this fiscal year. So it would be the 3 nursing unions that we mentioned, Senator, which is VISNA, LPNA, and RNLU. And then after completing those, our physicians are also unionized, and their union contract has been expired, I think, for at least 10 years. We recently redid SIU. We recently redid USW. So some of those other larger government-wide contracts are still pretty current. Sir.
So like I say, there's no easy fix, but let's address personnel first. Again, military style, police style, you address your personnel first, then you move outward. You address the infrastructure where they have to work in second, then you move outward. Then you add logistics, what becomes supplies and all those other things. But again, back to the employees. The retro money owed to SIU, what level of employees does that cover?
So that's some of our technical staff and support staff. That's in the SIU master contract, which is the government-wide contract. And it's really just that we're paying the current new negotiated rate to those employees, sir. We just need a little bit of catch-up for the period of between when the contract was signed and when the new rate was implemented. So it's $116,000 that we owe. And when the cash position allows that, we are committed to paying that to the SIU members.
Okay, so right now, do you have, in terms of cost-saving measures for generating revenue, do you have any austerity measures taking place? Energy, any solar systems, anything looking at that to enhance where you cost savings?
Yes, Senator DeGraff. We are working to look at every single line item of our expenses and see how we can reduce those expenses while still providing the essential care we have to provide. So we are putting in austerity measures. We're looking at our overtime expenses. We're looking at every way to cut costs, as well as looking at ways to increase the revenue that we generate. Sir, thank you.
And finally, if I may, Mr. Chair, you mentioned that you had 39 promotions in-house.
Yes, sir.
So how come then you don't ask for any more money to pay them? If you promote them, you had to pay them more money somewhere, what is exempt, non-union or whatever. So how come you have 39 in-house promotions, but you're not asking for any additional funding?
I agree with you in terms of that point, and in terms of your overall direction of needing to focus on our staff members first and facility second, and to exactly what you outlined. We do appreciate and value our staff. We have to work hard to generate additional funds and come up with additional contributions to be able to afford the necessary growth of our staff and the necessary onboarding of new staff to join our team. So we do appreciate any additional support that comes from the government, and we work hard to generate more of our own money and to cut our expenses where we can so that we can afford the things that we need to do that you very eloquently outlined.
So you can afford them in the 23 budget? That's what I'm basically asking. You're promoted 39. Can you pay them in the 23 budget?
We're committed to always making our payroll, Senator DeGraff, and so we will ensure that we can pay them as we have promoted them, sir.
Okay. Thank you for the time, Mr. Chair. Thank you.
Thank you, Senator DeGraff. And I think in terms of collections, you have increased your collections. So that's one way you're trying to generate additional monies to pay your expenses.
That's correct, Chairman Violet.
In reference to the Meditech system, are you using it to its full capacity?
We definitely have opportunities to optimize our use of the Meditech system, and we're hoping that as we transition to Meditech Expanse, we will more fully optimize our use of that technology.
Hold up one minute. Because I hear that, but if we're not using it to its full capacity, why do we believe that when we switch over to Meditech Expanse, that they're going to use it to its full capacity when they're not presently using the system that they have now the way that they're supposed to use it? Are they doing medication reconciliation and Meditech?
So I think it's a very valid question and a valid point. When we first started Meditech in the version that we have now, I don't think all of the modules were initially turned on. And so turning modules on requires labor of our clinical informatics nurses, essentially, and our other IT team to build out those modules. As we're transitioning to Meditech Expanse, the plan is to turn on those modules using the consulting contract that we will have. So when we go live on the new Meditech Expanse, all the modules that we have currently, including the ones that aren't turned on or optimized, will be optimized in the new system. And so we will be doing more things like computerized physician order entry, medication and reconciliation. We've grown our in-house system how we can, but it's not fully optimized in a way it will be.
Who's your IT person? Do we have somebody here?
Yes, sir. We have Mr. Brandon Richardson, who's our Vice President of IT, who can respond to any specific questions.
Yeah, can he step up?
Sure.
And you could right there and then. And put your name and title on the record. Pull the mic and put your name and title on the record.
Sure. Good morning. My name is Brandon Richardson. Hello. Brandon Richardson, Vice President of Information Systems.
Okay. In reference to Meditech and the modules that are turned on, are they being used to full capacity?
No, Senator.
Do we have medication reconciliation turned on?
No, Senator. We have been working in St. John in the Mary Keating's Health Center, and over there we have it turned on. But we're moving forward.
Okay, so why do we have it turned on in St. John that is 10% of St. Thomas and not turned on in St. Thomas that generates the most encounters?
That is a pilot project we had been started several months ago. So now going forward into Expanse, we'll get that resolved.
Okay, so we have already paid for that particular module?
Yes.
Medication administration.
I'm not sure about medication.
You see, my thing I'm coming with, I want to move in the direction of Meditech Expanse.
Yes.
But we got to use it now because they're still charting on paper, they're still writing a lot of notes, and we have the opportunity to capture a lot into the system so that we could receive more monies that would come back to the hospital because we have captured everything. So before we even go to Meditech Expanse, we got to make sure that we are using this one now. We're going to get Meditech Expanse. It's going to cost a tremendous amount of money, and then we have all these modules that we're not using. So all the nurses should be utilizing all the modules that are available. And if we're getting ready to implement or purchase Meditech Expanse, we need to turn on all of those modules now and get into the practice of doing it, because a lot of paper is still being charted. It's taking hours. It is creating overtime. We got to be able to move to the next level. I heard a traveler that's a Virgin Islander saying, that there were certain stuff that's in the system that could be utilized, but it wasn't being utilized. And when you went in, you could have just put it in. But for some reason, they're not using it. So I would just like to see a real initiative for them to use the present Meditech to its full capacity, what is turned on. Not 40% usage, 100%, because they must understand that we're getting ready to transition. And to transition, they need to use it.
Senator, if I may.
Yes.
As it stands right now, if we did turn it on now, we did utilize it now, the time it would take, we're normally about 3 to 6 months. And then secondly, those would not be able to be transferred into the new Expanse system. So we had to start all over from scratch with man hours, funding, etc. So a lot of the modules that weren't turned on, when we spoke with Meditech, they told us that we should defer that to Expanse.
Okay.
For that same reason.
Okay. So my simple request is what we have turned on and we're using, make sure they're using it 100% and not writing on papers. What we presently have turned on, make sure that is used. Senator James.
Thank you.
Good morning to the people of the U.S. Virgin Islands. Good morning, testifiers. You made mention of a total of 143 patients having to be transferred off island. for the past fiscal year. And you went on to say that a lot of the individuals who have good insurance, like the government, who takes part in the Cigna program, they are not utilizing the local hospital for their care. Have we found a way to rebrand the hospital, market better to keep those dollars there? What is the strategy?
Yes, good morning, Senator James, and thank you for the question. We have noted a definite need to increase the community's trust and to attract more insured patients to get the services that we do offer at Schneider, have them done by us. And so we are working actively right now to update our marketing and branding and our advertising. We have just unveiled a fresh version of our logo and our website. And so these things will be rolling out, and we're going to be promoting the good work that the professionals at Schneider Regional do and telling our good stories so that more people will feel confident in coming to us for their care. We have great professionals that work with us, very talented clinicians. All of our physicians are board certified, very, very talented nurses and support staff. And so we want those good stories to come out to the community, and we would like more folks to come to us for their care.
So have you ever considered getting testimonials from individuals who receive very great care, not just in a press release or a Word document, but an actual video? I have that video as a sponsored ad with a series of other individuals who experienced that good treatment here with knowing that they're insured?
Yes, sir. I mean, I think that's an excellent suggestion. We love hearing the good experiences that our patients have, and we want to share that with others. So I think your suggestion for the video testimonials is a good one, and it's one that's part of this new marketing campaign that we're launching.
Because we definitely want to keep those dollars here.
Yes, sir.
And have them circulating. And you made mention of an outstanding payable to WAPA in the total of $1.7 million. How did it reach to that point? And you briefly discussed it in your testimony, but can you let us know how we came to that point of an outstanding payable to WAPA in the total of $1.7 million?
Sure, and thank you for the question. So our monthly bill from WAPA averages $350,000 for our facilities, Schneider Hospital, Myra Keating Smith, and maintaining some level of electrical support to CKCI, even though it's closed. Our allotment is deducted automatically every month, $275,000 to go to WAPA. So there's a little bit of a difference every month between what we're billed and what automatically goes to them. We work hard to pay that, and it's a matter of juggling that payment to WAPA with our other demands for payment from other vendors, like who would supply us with blood products, with our staffing agency vendors. So it's a matter of balancing the cash position and all the vendors that need to be paid, including WAPA, but we're committed to paying WAPA, and so it's something that we have to work at how we pay that difference.
So my question to you, the $1.7 million, how long has it been this way? Like, it happened recently? It happened in the past 2 years? Give us a time frame.
I think there's always been some difference in some amount that's owed to WAPA, and we try to work to keep that under control. The current amount does total the $1.7 million.
2 minutes.
Because I really want you to rectify that. I dislike, and I highly dislike when departments, agencies, or hospitals, or WAPA, we have to do our due diligence, because the same way how you want to get your collections from when individuals come to the Wang Louis Hospital and you want to collect those payments, it's the same thing with the WAPA situation. Of course, WAPA is a hot mess, but we just want to make sure WAPA get what they deserve. As far as the government agencies, it was made mention that the Bureau of Correction owes you roughly $700,000. Can you just give us an idea of what they are doing as far as the conversations being had, so they can come as a whole and be able to pay you guys?
Yes, sir. I think we need to have some additional conversations with the Bureau of Corrections and talk about how we can work on paying some of that outstanding amount. We do provide services to their clients and to inmates of the Bureau of Correction if they are unable to treat and or stabilize the condition within their system. They bring the inmate or detainee to us, and then we provide whatever acute care or stabilization care is required in our emergency department. And so that's how that amount has grown, and we have to work with them about paying that outstanding amount.
Please be aggressive with all those government agencies who owes you. Don't have any leniency on them. Of course, we're the one that fund you, but at the same time, we must do our part.
Yes, sir.
Thank you.
And I see where you made mention worksman compensation that the Schneider Regional Medical Center owes $3.7 million. What are you doing to rectify that issue?
So we are in conversations, Senator James, with Workman's Comp, with leadership over that program. We have, over the past year, worked, this amount is reduced from what it was a year ago, because we've worked with them to pay some of the very old claims. And so we're continuing those discussions actively towards paying the amount that remains and processing claims. So part of that includes us submitting additional medical bills and supporting documentation to substantiate the claims. And some of it are claims that have been recognized that need to be paid.
Time.
Please aggressively go after everyone that owes you and pay those who you owe as well in the process.
Will do.
And lastly, Mr. Chair, with your indulgence, you made mention that Schneider Regional Medical Center owes for 2 months when it comes to GRS, if I'm not mistaken.
That's correct, Senator
$1.4
James.
million. And you made mention that 2 employees were affected by that situation. Have we dealt with those two retirees?
We're working to resolve the situation with GRS, Senator James, such that they will be able to complete the processing of their retirement benefits so they can start to collect their retirement checks, sir.
And we have more individuals who are about to retire as well, right?
Correct. So we're working to get it completely rectified by September so that it won't affect anyone else who is retiring from Schneider.
Please. Thank you, Mr. Chair, for the time.
Thank you, Senator James. What's the name of the pediatric cardiologist? Can you put the name on the record?
Dr. Volt Loyal is a pediatric cardiologist who rotates here in the Virgin Islands, and he provides much needed services to that population, helping to keep children on island that otherwise would have had to leave for care.
He's a locum?
He's a long-term rotating physician, so he's not coming strictly in a locums capacity. We more consider him part of our extended staff, but his services are only available for a certain period each month. He doesn't live permanently on island.
Okay, thank you so much. Senator Francis? Sure. Point of inquiry before Senator Francis, Senator Blyden. He did say it before you, Senator. Senator Blyden, Mike.
Thank you, Mr. Chair. Mr. Mayors, based on the last speaker comment in respect to WAPA, I know in its testimony it was mentioned that you bill $350 a month, but you only pay $275. The $75,000 difference. Year to date, what's the outstanding balance for this fiscal year? Year to date.
Good afternoon again, Senator.
Please state your name before you speak, dear stenographer.
Yes, my name is Stephen Mayers, and I'm the controller for Schneider Regional Medical Center. As regards that different, what we do a number of things. One of them is that there's a direct allocation from OMB of the $275. In addition to that, which I know on a regular basis we pay Myra Keating utility bills as well separately. That difference between the $350 and Myra Keating and the $275 is what has accrued somewhat over the years.
So for this year to date, so you haven't paid the difference at all. You have not done anything to address the difference of the $75,000 monthly.
From time to time, we pay some of it, depending on the availability of funding. But that's what.
So do you have a standing balance right now as we speak?
That's the 1.75.
Okay,
that difference was Senator, just for information, was larger at the beginning of the year. We've chipped into it a little bit.
I'm clear now. Thank you so much, Mr. Chair.
1.75 million?
Correct.
Quickly, Senator Joseph.
Thank you kindly. My question does go to your accounts payable. Also, because I noted from the previous year, I know we've had a change in management, it was noted that one of the highlights was the extraordinary testament of the financial stewardship was Schneider Regional ability to pay its IRS, GRS, and WAPA, and that they were all current. And this was when your predecessor testified last year. My question is, where are we as far as the IRS payment? I don't recall seeing that in your testimony. Thank
you, Senator.
That's my inquiry.
Thank you. Go ahead and respond.
Yes, Senator Joseph. I will defer to Stephen Mayer to officially answer the question on the record, but I do believe that Schneider has been current with making the other payments that were mentioned in last year's testimony, except for that fall off. But I will defer to Mr. Mayer to respond onto the IRS specifically.
Good afternoon again, Senators. My name is Stephen Mayers. I'm the controller at SRMC. Yes, we have no outstanding balance for the IRB.
Thank you, Senator Joseph. Have you sent the vendor payment, outstanding vendor payments? Has somebody sent it yet?
Chair, good afternoon again, Stephen Mayers. I did get a listing. I need to review it before I send it to you, if that would be okay with the Senator.
We need it today.
We'll get it.
Yes, you will get it today, please, sir.
Okay. Senator Francis, you recognize.
Thank you very much, Mr. Chair. Good morning to you, my colleagues. Good morning to Central staff, as well as good morning to the Schneider Hospital family there today. I want to thank you very much, CEO Comissiong, for your comprehensive, in-depth testimony this morning and providing a lot of information to us. In respect to morale, well, before I go to morale issue, I wanted to also commend the facilities management team and the work that they're doing there in-house. I think that that's significant, and I'm hoping that that can continue to occur because it helps to save you funding. So I want to commend them for the work that they're doing there. Can you speak to the morale at the center at this time?
Yes, Senator Francis, good morning. CEO Comissiong. We are working hard at Schneider Regional to improve the morale. We realize that there are opportunities for us to continue to work with our staff members, listen to our staff members, and make changes based on their requests. So I have been hosting a CEO CCEL luncheon where we have employees from across the organization come and sit and discuss in a very open forum with no retribution for anything discussed, their concerns, their issues, their needs, and we are working as an executive team to be responsive to that. We know that there has been a long time where the compensation and remuneration for the great efforts have been requested, and we're working to get that flowing. We are very thankful for the new infusion of funds that's going to help us to do some of the retention because the monetary part is a big part of morale and making people understand that they're valued. We do value them and we appreciate them, and we need to show that and demonstrate that tangibly with that financial recognition. But we are working to improve our facilities, listen to our staff, meet with our staff regularly, and do all we can to improve morale.
Madam CEO, let me interrupt you a second.
Sure.
You have just taken almost 3 minutes of my time,
Sorry.
and you still haven't answered my question. My question is, how is morale?
I think
I'm hearing everything that would have been my second part of the question, but my first part was, how was morale?
I think the morale overall is okay. I think there are a lot of people committed to the success of our hospital. There are a lot of people who love what they do. There are a lot of people committed to our community who want to see our hospital succeed. And so we're glad for that energy. We're putting a new energy into things. And I think the morale is improving and will continue to improve.
So if you had to give it a number between 0 and 9, what would that be?
I would say 7 trending to 8 and gonna hopefully hit 9+ as we continue the work that we're doing.
Thank you very much for that. So it wasn't a got you question. This is really just to ask how is morale there. I know that there's a lot going on, and certainly in the level of the fact that individuals are not receiving their pay, all of the other issues that's challenging. I just wanted to know how our employees are doing. So thank you for that. What is your ask today? I heard you spoke about the budget that has been sent down by the administration, You were asking for financial support for new RNs at a tune of about $3 million. I also heard you talk about the Omnicell, $1.5 million for the automatic dispensing cabinet. So what is your ask today of this body in aggregate?
So I think, Senator Francis, you very nicely summarized the major asks from our testimony. Officially, we are requesting $28,750,000, but we are very appreciative and know that we have a need for the additional support, specifically for the nursing salary increases, which are about $3 million, and to support our equipment purchase of the upgrade to Omnicell, which we were partially able to start on with funds from this body, that we need to continue to pay the $1.5 million to complete that purchase. So I think those are our major needs for this budget cycle.
2 minutes.
Very well. And in respect to the some of the challenges that you're experiencing with staff and where I think that we're literally bleeding money, what is the discussion in regards to the contract negotiation? You really just do you have the power to at least start the conversation by respect to how much you'll be able to afford to pay in regards to contract negotiation? Is that correct? Or are you leaving that up to someone else to determine?
Yes, Senator, that's correct. So, Senator Francis, we have done a comprehensive look at what the national averages are, what our local costs of living are, what we know we need to get to be competitive, and we've put together a proposed pay plan for our nurses. We've done that collaboratively with JFL. CEO Cook and I are in full agreement about the proposed tables, and based on those proposed tables is how we came up with the costing estimates of the $3 million to effectuate those new pay plans.
And based on that assessment, I guess you'll be getting closer to the national trend, or at least be a little bit more attractive in respect to what our nurses will be able to receive?
That's correct, Senator Francis. So by fixing the salary tables to the level that we have planned for and adding the retention bonuses, which are made possible by the governor through the allotment of the ARPA funds, we will be much more competitive, I think, and much more successful in recruiting and retaining qualified clinical staff, especially nurses, for our organization.
Very well. And in respect to revenue collection, are you having issues with bounce check at your facility? What is the level of bounce checks? And also, if you can just speak to whether or not you're utilizing the telecheck service there.
I haven't heard of any specific reports of a high incidence of bounce checks, but I will defer to Mr. Stephen Mayer to provide confirmation on that question, sir.
Time.
Good afternoon, Senator. The Chair, Stephen Mayers again, Controller. I haven't been, it hasn't been brought to my attention that we have a particularly high rate of bounce checks, so that is not a particular issue that I think sort of dominates any of our issues at this time.
Not a problem. Mr. Chair, if I could just wrap up with one final
yes,
on this round.
You may.
Thank you. And in respect to litigation or judgment, Madam CEO, do you have any issues or concern? Are you asking this body to be able to recognize any particular judgment that have been levied against the center that need to be considered in this budget cycle?
Yes, Senator Francis. So just for awareness and transparency, the organization has one judgment against it, slightly exceeding the amount of $1.79 million at the time of the judgment, $1.7 million. It has continued to accrue interest since the time of the judgment. And so being able to pay that judgment as soon as possible will stop interest from continuing to accrue and will put the organization in compliance with the order of the court.
Is there a request on this budget for that purpose, or do we need to, again, do an addendum to that?
Senator Francis, it's not included directly within the budget request of the 28.750, so it would be a separate allotment or a separate appropriation to cover that additional expense if the legislature so chose. Thank you.
Thank you very much. Thank you, Mr. Chair, for the time. Thank you for your responses, Commissioner.
Thank you, Senator.
Madam C.
My pleasure. Thank you.
Thank you, Senator Francis. Can you submit to this committee that settlement agreement?
Yes, sir, I will.
Thank you so much. Senator Joseph, you're recognized.
A pleasant good day to you, Mr. Chairman, and also to the testifiers. I really want to begin by commending the leadership, the new leadership at Schneider Regional Medical Center for all the hard work you're doing. I especially read with interest your testimony, and I wanted to just highlight one of the items that you stated in your testimony, specifically on page 10. In the third paragraph, you say, we implore this body to work with us at reshaping the largest healthcare and insurance landscape. I want to put it on the record that I am committed to working with you, and I know definitely you would be committed to working with all of us here. Okay.
Thank you, Senator.
Thank you. So I want to go straight into some of my concerns relative to your budget. I know we are having some major challenges fiscally with paying down our GRS as well as our utilities. Now, I noted that you have spent, I think it was $92,000 biweekly for overtime. How are you addressing overtime? Because in your budget, it represents $2 million you spend annually for payroll plus fringe benefit. If you multiply $92,000 biweekly times 26, you are spending in excess of that amount that you spend for personnel and fringe annually. It's over $2 million. So how are you addressing overtime? I know you have some challenges with personnel and getting the workforce and manpower that is required. Is everywhere in government, is everywhere now in the private sector. What are you doing? What are you doing to try to look at reducing the overtime cost?
Thank you for your commitment to working with us, Senator Josephs. I'd like to start there, and thank you also for your question as relates to overtime. So our biweekly payroll is about $2 million. Just for clarity, for the record, our biweekly payroll is $2 million, and our biweekly and our biweekly overtime is about $92,000. So on the post auditor's report, if you look at our overtime pay for the year, it's about $2 million, just over $2 million for the year in overtime, and that's what we're trying to cut back. It's a little difficult to cut back on our overtime expenses right now because we're so short-staffed, and we have to have enough nurses to take care of our patients. So where we don't have enough physical bodies, we have to supplement by asking our existing staff to work with us and do the overtime to take care of our patients. And so that does add up. And it's a balance in terms of ensuring safe nurse-to-patient ratios and managing the overtime expense. So if we really want to manage overtime expense, we have to figure out how we get more efficient at what we do and how we cut back on unnecessary overtime. And so that's something that our team is looking at and is working to do.
And thank you for that clarification, because I surely did misread that.
My pleasure.
And so I'm glad that I asked the question, because I was like, it did not make any sense to me, but I did misread that. Now let's look at your less bad debt and compare it with the Meditech that you plan to upgrade and include. How do you see your reduction in your bad debt? And explain and try to be succinct, because I have another question.
Sure.
How that correlates to increasing your revenue generation using what you plan to put in place with the Meditech.
Sure, and thanks for the question. I'll try to answer it briefly. Our bad debt is a calculation that's money that is billed that we don't expect to collect anymore after making diligent efforts to collect it. So we have a bill, we've sent it out, we've chased it down for 3 months, 6 months, whatever the time frame is, and we have no hope of collecting on that. That becomes bad debt. And bad debt is just one component of our uncompensated care. So our bad debt in the past year was close to $11 million of bills we sent out that we do not expect to collect, even after diligent efforts to collect that. With the new Meditech Expand system, it'll help us more with our coding, our billing, our collecting, and it will help us, hopefully, to be able to drop cleaner bills more timely, and so we're able to collect more for the services that we do. It's part of our overall improvements in revenue cycle.
So do you have with the bad debt collection, because it's right now it says fiscal year 2023, it's about $10.4 million based on page 5 of the post audit. Even though you may have given out, you have an agency in place that is still pursuing that, correct?
Yes.
And have you seen any additional revenues or reduction in that bad debt come in? And if you have, could you please indicate it to us?
So a slight point of clarification there. So we have a large amount of bills that we have sent out that we haven't collected on yet. And we have teams, both in-house and external consultants, working hard to collect on those bills. At some point after a year, let's say, of trying to collect on that, both internally and using the external consultant, when we realize there's really no hope of collecting on that bill, we then classify it as bad debt and then it gets written off. So there's no more efforts after a certain point.
Okay, so do you have a goal as far as monthly goals to be able to collect on those amounts that are outstanding to you?
Yes.
Okay, so
yes,
that's
definitely.
that's
so that we reduce the number that becomes the bad debt number. Correct.
What is your goal? Do you have as a monthly basis or an annual basis?
Yeah, so our goal is to reduce the denials, increase our collections, reduce the days of discharge to final bill. So there's a lot of separate activities happening within revenue cycle to try to prepare a bill cleaner sooner and then use our internal staff by adding internal staff.
Time.
Just as far as quantitatively, what is your number?
I'll defer to Mr. Mayor for the specific goal because I don't have the percentage on the top of my mind, but I know it's what we're working to collect more so less becomes bad debt.
Again, good afternoon, Senators. My name is Stephen Myers. The overall goal is to get to that $6 million magical number for us on a monthly basis.
On a monthly?
Correct.
Okay, thank you. Mr. Chairman, thank you so much. I'm sure somebody will follow up and ask how much they're meeting their goals. Thank you so much for the time. I appreciate that.
Thank you, Senator Joseph. Senator Sorrow.
Thank you. Thank you, Mr. Chair, and good afternoon to all. So let's start on MAP. So with the Build Back Better Act by Congress, there was a increase in FMAP. And like Puerto Rico, if you exhaust all of that in a fiscal year, you receive no more funding for your FMAP. Have we ever exhausted all of our FMAP funding?
I'll defer to Mr. Mayor, but I do believe that for us, it has historically been both an issue in the rate that we receive and hitting the cap. Now the rate is much better, so we're able to collect more through the Medicaid program with the changes that have been made to get us up to the 84%
So
on
recently
average.
you haven't exhausted?
I think we still do hit the cap, but I'll defer to Mr. Mayor.
Because this does affect your numbers.
Yeah.
Correct. I couldn't say specifically whether we have or have not at this stage hit the cap. Our challenge has always been just the rate of...
No, I get the challenge.
Okay.
I just want to know if you meet the cap. Because I know even with the continuing resolution now, when that expires, the Build Back Better Act, it results in a lower FMAP rate to the territories, which would require more local dollars for you to draw down the federal dollars, correct?
That's correct, Senator.
Okay, so you think that you've met the cap?
I will certainly do the research because I don't want to put the incorrect answer on the record, and I will get that to you within the week through the chair.
Okay. Now, let's go to the presumptive eligibility. There's no way we could maximize, because I think the presumptive eligibility, the salary qualification, I think it's based on Puerto Rico. So who on this team is having a discussion with Congress to discuss the salary for presumptive eligibility? Because people are not making 15. I mean, I know we're struggling with a median salary and a good quality of life, but a lot of people are making more than $15,000. So we're not able to really maximize the benefit of the presumptive eligibility program. So who's having that discussion with Congresswoman Plaskett? Because she's making waves, apparently, So this needs to be part of our new agenda.
Yeah, it's an excellent point, Senator Thoreau. And I had the conversation with Medicaid and with some consultants who work with Medicaid at the federal level and with CMS about this very issue within the past month. And we've also had the conversation with the CEO for JFL, Mr. Cook. Our plan is to put together a group of stakeholders to include some senators, yourself if you're interested, please, and hospital executives, and the delegate to Congress, who has been doing great work, as you mentioned, so that we can work together at convincing the federal government to look at it a little bit differently.
Because like a feel-good legislation, it does not benefit to a good extent the Virgin Islands, the U.S. Virgin Islands.
My understanding is it's set at a percentage above the federal poverty level, so we have to work at still saying 15,000 is too low. So there are a lot of people who can't qualify for that, but yet still can't afford to pay for the private insurance, and so we're left with a huge portion of our population that's uninsured.
Okay, so let's go to TEFRA rebasing. Next issue. Because we can't just keep throwing money at you. We really have to make a dent on a federal level between the FMAP, presumptive eligibility, and TEFRA. Where are we on TEFRA rebasing?
So TEFRA rebasing is something that we always ask for. It's one of the things, it's like number 2 that I had in the conversation that we had with CMS when we met with them most recently. It's something that we know we want to pursue, and not only necessarily changing off of TEFRA, because TEFRA is cost-based reimbursement, which is good for us, where we have extended lengths of stay, et cetera, to receive the daily rate versus receive a capitated amount for the care. But how do we get rebased? How do we get a more current base year?
So
and
how
do we make ourselves qualify for some of the programs that exist elsewhere, like disproportional share? So if we got our percentage of a population that we serve in any other place would qualify us for disproportional share, but because we're on TEFRA, we can't qualify for DISH. So there are carve-outs that we need to try to apply for.
So tell me your timeline.
So it's
You're young
part
and
of the same
energetic, so
group.
tell me, when is this?
The same group of stakeholders that we're going to put together to lobby for some of these changes, I think that's definitely an agenda item for us to work on collectively.
Now, page 8, outpatient upstream and downstream activities left has cost you a loss in revenue. What's the plan to get some of that back?
So I think that's what we're trying to describe throughout the testimony in terms of improving the services that we do deliver, and then letting the public know what we do well and how we're improving, so that folks want to come to us, because that improves the payer mix.
So pause. So that goes to the next question, and best practices. You and I had an offline discussion.
Yes.
And what is a plan to improve best practices? Because we did make a comparison. Let's talk about volleyball. You play volleyball.
Mm-hmm.
If you go from coach to coach to coach in the Virgin Islands, and you are taught things that are not really best practices in the sport, then you end up with wrong feet, wrong technique, and you think it's right.
Mm-hmm.
So when you have nurses leaving from UVI to come straight to the hospital, and they haven't really worked in a hospital elsewhere to see best practices, we end up adopting, no offense to anybody from UVI and the hospital, but we end up adopting archaic or not so good practices, and we think it's good. So what is the plan to really adopt best practices? I have a nurse in my life, so I need to know who does have concerns and are valid concerns. Mm-hmm. So what is the plan to adopt those best practices so people could feel comfortable coming to you? Because you're losing revenue. Because if I don't feel well and I have time, I will catch the plane. If I have time to live, people will catch the plane and I'll go to Schneider. So talk to me quickly.
Well, we want you to stay, and we want others to stay, so we can take good care of you. But we have to continually look at the best practices. Healthcare and hospitals, especially acute care, is a constantly evolving field. And so we have to stay abreast of those changes. We have to work with our educational institute to then take those best practices that we're seeing and teach our staff them, and then have our staff teach incoming nurses as we're training them in the best way and the right way to do things. You mentioned working in other facilities. One of the things that we're talking about and exploring is setting up an exchange program where our nurses can go to another facility in the States and do a 3-month type rotation, like as if they were going to become a traveler, but they come back to us. To give our nurses that experience of seeing what's done elsewhere, to have an experience of traveling, but then hopefully to bring them back with the skills that they acquired to then teach their peers who are here. So we do need to move in the direction of more best practices. And you made the analogy to volleyball. If you're a volleyball player and you want to go and play in the facility that has the nicest locker room where you can take a comfortable shower afterwards. And it's the same for a patient. So we can't necessarily knock the patient for wanting to go where the red carpet is rolled out or where it's very convenient. You pull up, you park, you walk in, you have your service done immediately, like some of the outpatient places here. We have to get more like that, and we have to do better at that so that patients have that experience at Schneider too, and they want to come to us. It's a little difficult to do that because we have to take care of everybody. And so if, as the funds continue to improve, we'll be able to do more of that.
Mr. Chair, do we get a second round of rapid fire?
I seriously doubt it. So if you have one more question, go ahead.
Okay. Lab, when you had the previous CEO here, Dr. Amaru, we talked about labs, because so many of our labs are sent to Quest Diagnostics, and then he indicated that the hospital does have the equipment to do a lot of the lab work. So are we utilizing the lab as a revenue generator? So when you go to like community medical lab, they could send their things over to the hospital, and then we get that back in a short span of time. Because right now, when you do Quest, you're waiting 3-4 weeks for some results, when our hospital, I believe, is capable enough through its lab to generate revenue and still give quicker results. Thank you for the latitude, Mr. Chair.
Thank you, Senator Stroh, for that last question. And I definitely agree with you. Our lab has a tremendous capability to do a number of tests that some of the other labs have to send off island. And we continue the work that was started in that area. We're pushing forward. We're expanding our lab even more. We want to work to build relationships with the other labs so that they will send their things to us that we can process here, and so the patient gets their results sooner, and it is revenue generating for us. And we want to work with the medical practices to let them know we have a great lab. Send your patient samples to us, send your patients to us to do their lab work. And what we have to work to do to encourage that business is, again, update our IT system so that when you come and you have the lab done by us, your provider can get the results directly dropped to them in a way that's convenient for them and easy for them to check it. And maybe even making it seamless where we interface with their EMR so your lab results are right there in their system. And they can look and see what your labs are without it being a 5-step process of having to call the hospital and is the lab ready yet? You know what I mean? They automatically get the labs dropped to them.
Okay.
It's much more convenient for them.
Okay, thank you, CEO Comissiong. So as we move along, I want you to give the medical answer and not the law answer.
I will try my best.
You speak like you're in court. So, I like your idea. I like the fact that you said perhaps we should send some nurses on a 3-month rotation on the mainland so they could get a different experience. And I would suggest that we begin with those nurses who are mentoring our new nurses so that they could really know the best practices, and we could be able to expand, because a lot of people don't have the ability or capacity to fly off island to anything. And this is the only place that they can go. So we got to make sure that some of the best practices that we just immediately implement. And best practices a lot of time don't cost money. It's just changing the way that we do stuff. So we really seriously need to address best practices. And even if they don't go, we could just partner with the next institution that we know provide quality health care and ask them to share their best practices with us and see how we match up. In certain areas, we might be right there. In certain areas, we need to improve. And let's just move along that particular corridor. Senator Campbell, you're recognized.
Thank you, Mr. Chair, and good afternoon to you, to my colleagues, to Schneider Medical Regional Center team, and to the viewing and listening audience. I like that idea about sending our nurses to get training off island, but I do have my concern. I think first we need to address with their salary rate pay scale, because it might have a flip side. We might lose them once they are offered the salary at the national level in some of these institutions. So I think we need to address that first, because the flip side is that they might like where they were sent and they might stay. So we definitely need to pay our nurses. I want to commend you and your team for the very comprehensive
well written out testimony you presented to us this morning. And I would like to see, as you continue to come before the committee, I think one of the things that we want to see is that GVA appropriation would be reduced and the center becomes more self-sustaining. I think that's the goal that you and your team should be reaching to, projecting to. I saw that you presented some strategic initiatives within your testimony, some areas that you all have identified that need to work on and improve. Improving our financial position, increasing our permanent staffing, and so forth. I would want to believe that you have a plan for each one of these that you presented here.
Yes, Senator Carrion. We do.
Okay. You were going to say something?
No additional comment. I was just saying, yes, we do. We have a plan behind each of those 5 strategic initiatives.
Good. And then you mentioned improving our supply chain management. What are the challenges that you're having with your supply chain at the moment?
Yes, Senator, thank you for the question. So there are national supply chain issues right now with the backlogs that were discussed a little bit earlier in the presentation for supplies across the board. But in addition to that, we've had some challenges just with the rising AP, being able to manage the amounts that we have to pay for the supplies and staying current with our payments to vendors. So we're working diligently to pay our vendors on time, thereby not being placed on hold and ensuring that we can get the supplies that we order timely.
Got you. And then the cost for contracted labor. I know we have a shortage and it's something that we can't really opt out of. What's the total cost in contracted labor and what are the plans?
Yes, excellent question, Senator. So the cost for contract labor for Schneider Regional was $7.2 million in FY 2021. We're on track to be at least that for this fiscal year, probably close to $8 million on contract staff for this fiscal year. We have to work to increase our numbers of permanent staffing in nursing and allied health and even with some physician positions. By fixing the rates, especially for nursing, we'll be able to be more attractive in recruiting and we'll be able to retain what we have. And that should help us then reduce our reliance on this expensive contracted labor. So it's money well invested, I think, to fix the salaries.
Yeah, and I do understand that this is necessary because we need to continue providing that quality care to the patients. But interestingly, I saw that your overtime numbers it's not a lot. What is that currently?
Our overtime is approximately $92,000 biweekly, which it annualizes to about $2 million per year.
$2 per year.
Mm-hmm.
2 minutes.
Very well. Let me go here to my other question I had. You did mention about the agent facility in your testimony, and you said that it's approximately $3.9 million in minimum expenditure necessary per year. And you finished saying that we spend a significant amount on maintaining our agent equipment. What is that significant amount?
So I don't have in front of me the exact amount, but when you have older equipment, for example, an older x-ray machine, when the machine goes down and needs a part, we have to source the part. A lot of times the parts are no longer in production. You have to bring a repair person to fix it. So there's an expense associated with repairing the equipment. And there's also the revenue that's lost because you have downtime and you can't use the equipment as much as you want to. So these become expensive situations, sir.
What expenses you have had in replacing some of these equipment?
Sure. So I will actually defer this question to our Vice President of Facilities and Engineering, who helps to maintain most of the medical equipment, so he can describe some of the repairs that we have done so far this fiscal year on some of our equipment.
Peter Jean-Baptiste, Vice President of Facilities and Engineering. We have replaced our CT scanner, which costs, I'm not sure about the exact number, but we replaced our X-ray machine, our fluoro machine.
Have general idea. excuse me, a general idea of the figure amount.
I don't have the exact figure amount. Send it back. We could get that to you.
We can certainly
Okay, if you
compile
can.
that. Yes, we can certainly compile that for you, Senator, and send it to you through the chair.
Good. And then you mentioned about your improvements in your collection area. And then I must highlight that you said that now you're able to process online billing.
Time.
Yes, Senator, we are.
So congratulations for that.
Thank
I just
you.
wanted to know how much has that contributed to the increase, if any, and how much is that in your collections?
Yeah, we do get a significant amount of traffic over our online bill pay. Mr. Mayor may have the specific amount, or if not, happy to compile the exact number of how much we received and what percentage that is through the online bill pay versus traditional payment methods.
Good afternoon, Senator Stephen Mayers again. I don't have that number, that specific number available right now, but I'll get that to you sometime today.
Can you at least tell me then what is your percentage of improvement or increase by percentage from the last 2-3 years in your collection?
Again, Stephen Mayers. Senator, one of the things that we have done, and certainly in this budget, you will see that we are trying to reach that $6 million figure per month. We have, in the last few months that I've been here, we've been able to attain something north of $5 million per month. We are very happy about and excited. We are putting in place in the next month or so some additional collectors with the hope that, or the expectation that we'll reach that $6 million early in the new financial year, FY23. So that is the plan now, and so that $5 to $6 million is going to get us to that anywhere between $60 and $70 million in terms of our actual collections in the new financial.
In the past, we collected, for example, between $3.5 to $4 million a month, and we've continually grown that over the past couple of years to being most months at least $4 million per month, and then more recently even approaching the $5 million and exceeding the $5 million a month. And we want to continue that trend of collecting everything we can for the services we provide, growing to the $6 million mark as was discussed by Mr. Mayor.
Thank you. Thank you, Mr. Chair.
Thank you, Senator Carrion. Senator Gittins, you recognize.
Thank you, Mr. Chair, and good afternoon to all. Let me first begin by thanking all our healthcare professionals for all that they do, even prior to the pandemic. And as I have to add my 2 cents, that as stated by the previous speaker, I too am excited to hear that our nurses or any employees will be able to get outside training, have an opportunity to travel, to expand their training, etc. However, I too am concerned that we may lose them as a result of this process. So I would echo the sentiments to let's take care of our professionals. Now, I want to be consistent as I did for the hearing with the Governor Juan Francisco Luis Hospital staff. So I will ask from the CEO and everyone that's there to kindly put your name, title, and salary on the record, starting with the CEO.
Tina Comissiong, CEO, $300,000.
Yvonne Thomas, Interim Chief Nursing Officer, $152,000.
Peter John Baptiste, VP of Facilities, $135,000.
Sir, repeat that again.
Peter John Baptiste, VP of Facilities, $135,000.
What? One what?
135.
Thank you.
Darrell Smalls, Executive Director, THRT, $190,000.
Stephen Mayers, Controller, 120,000.
Valder Bruno Durand, HR Recruiter, 70,000.
Brandon.
I didn't hear.
Valder Bruno Durand, HR Recruiter, 70,000.
Brandon Richardson, Vice President of Information Systems, 120,000. You didn't hear me?
Yeah, pull the mic closer.
Brandon Richardson, Vice President of Information Systems, 120,000.
Thank you. That's it.
That's it, Senator.
Thank you. My staff will do that tabbing for me as I continue with the time I have left. Does the Schneider Regional Medical Center have the DHS Medicaid person stationed at the hospital?
We do have
to
an
enroll anything for services that's uninsured?
Yes, Senator Gittens, we have an employee who works with the Department of Human Services, who works with the Presumptive Eligibility Program, who works with us at the hospital to enroll eligible persons onto that program, as well as our staff work on it collaboratively with them.
The answer is yes. The answer is yes.
Yes.
Is this on an 8-hour basis or round the clock?
The person is assigned by Department of Human Services on an 8-hour daily basis, is my understanding of their schedule. But we don't dictate their hours.
So I'm saying, so after 5 o'clock, how do we capture the enrollment of those uninsured?
2 minutes.
So presumptive eligibility is a self-attestation process. Our team works collaboratively with DHS to enroll people into presumptive eligibility. And so our patient access team is familiar with the process and is trained on how to encourage persons who may be eligible to apply for presumptive eligibility.
So we are capturing this then?
We work to capture everyone who is eligible around the clock, 24/7.
Thank you. On page 4 of your testimony, you spoke to losing nurses. You spoke about in 2021, some 80 full-time employees, of which 21 are RNs. In 2022, you spoke of 34 full-time employees, of which 11 are RNs. Now, you know, there are a lot of nurses as well that we're realizing that we're losing, and some actually going to work for other private entities that are in contractual agreement with our hospitals, and they're being paid 2 to 3 times more than being a full-time employee at the hospital. Now, you also spoke about going to the table for contract negotiations. How long have these nurses not been to the table?
The nurses union contract was renegotiated about 5 years ago, and so it's been about 18 months to 2 years that it has expired, and it's time to get them back to the table. I agree with your observations that they are not being paid competitively or comparatively to the folks who come as travelers.
So I would say that I hope that it wasn't just a good statement to make that we will be going to the table soon. I'm truly hopeful, and I will follow up to ensure that you all do sit to the table to address the salaries of these nurses. Now, as it pertains to locum tenens, as you've stated, it's at a high cost to our hospital. Now, I know in St. Croix, I know for sure, I'm not sure if it's the same on St. Thomas, but why does it seem like we prefer go the route of hiring locum tenens than to hire doctors on staff directly? Is this the same at Schneider Regional?
Yes, Senator Gittens, it's definitely our preference to hire permanent full-time physicians that are invested in our community and invested in our patients. And so that's always our goal. Where we are unable to recruit and hire permanent physicians, we do contract with locum tenens providers to ensure that we have coverage for safe patient care for the patients that we have to take care of.
Thank you. Now, the premium pay, you also
Senator,
stated that...
your time has been called, but you could conclude. You may conclude.
Wow. Thank you. Premium pay, you stated that you've started to pay out?
Yes, Senator Gittens, as we have received the disbursements from the central government, we have immediately issued them to staff. They are coming out on a rolling basis, and so we've only gotten the first set of them, and we anticipate future sets to be coming on a schedule as dictated by the central government.
What about those making the 70,000 or more?
The Senator Gittens, we were able to work with OMB at getting an exception file to allow persons, specifically nurses and other clinical professionals who make more than 70,000 included in the premium pay allotments.
Thank you. And lastly, Mr. Chair, about August 11th, the USDA announced that it had awarded some $74 million in community facilities, emergency rural health care grants, with hospitals and health care facilities in almost every state and territory receiving something. Did Schneider Regional Medical Center apply for any of these grant monies?
We recently saw that announcement, Senator Gittens, and we are researching that to see if we can qualify. Unfortunately, sometimes our designation as a TEFRA hospital excludes us from some of those programs. For example, being designated a rural hospital and or a sole community hospital, which are categories that otherwise by every definition we fit in. But we're not always eligible for those programs, and so we have to do research into that. We are aware of exactly the release you're describing.
So the answer to this question is that you have not applied.
The answer to the question is we've not received any notice that we are eligible for that program, and we've not received any notice that we have been awarded any funds under that program, but we are researching it to see if we can be eligible, and if so, if any of the money can be allocated for our hospital.
Thank you. Thank you, Mr. Chair.
Thank you, Senator. That was a competitive grant or just a...
I'm still not exactly clear on the details of the program because the announcement was just made within the past week that we became aware of it.
Okay. Senator Francis Heiliger.
Good. Is it on?
Senator Francis Heiliger, mic, please.
Thank you. Good afternoon to my colleagues, to the testifiers, to the people of the territory. As a resident of this territory, we all know how important our hospitals are. And given any opportunity to really speak to you, to dive into the pluses and the minuses of running the hospital here in this specific district is an opportunity I intend to tap into. Earlier you spoke about over $1 million plus judgment that potentially might have to get amended into giving you if someone sees fit. How often does the hospital get sued, and do you guys do an analysis as to what types of lawsuits are being done and what kind of safety measures or specifically targeted issues that you could correct to reduce the amount of suits placed at the hospital on an annual basis?
Sure, and thank you for the question, Senator Francis Heiliger. The judgment that we described that's outstanding is actually not directly related to patient care. That's a judgment around a construction activity that's very old case.
That's fine.
We do track the types of cases that are filed against the hospital. We have certain cases that are medical malpractice cases. Those have an insurance fund that we participate in, so that covers those outcomes. But we do work internally with our quality and performance team to do assessments and reviews as outlined within the code to look at where there are errors and to make changes to processes where we need to, or equipment or communication and other things. Staffing sometimes is part of that. to avoid future similar negative outcomes. And so, yes, we're tracking the types of cases, both both civil and medical malpractice, and we are working to address the root causes of the medical malpractice claims so we don't have them anymore.
Okay.
Yeah.
We talked about in your testimony, one of the things that we had a discussion about had to do with the COVID relief funds and the disaster recovery funds. How have you guys utilized any of that in regards to staffing, dealing with the facility? How have you really tapped into the utilization of that?
Sure. So, Senator, at the beginning of COVID and when COVID was starting to grow, we recognized that as the only hospital in our community, we're going to have to prepare ourselves to treat that condition. And so we have expanded our patient care spaces within our hospital to accommodate now a highly infectious disease unit. And on that unit, we put in negative pressure rooms and we put in a whole host of other facilities, improvements to make that area safe to take care of patients. So that's one way that we spent some of the COVID money that came. Mm-hmm. Additionally, we get some support of PAFFord personnel through the Department of Health to support the COVID activities, as well as now we're seeking some of our own reimbursement for the money we expended related to COVID.
Well, speaking on reimbursement, I knew during the COVID era, they had reimbursements that had been increased 7 to 9 times. Did you guys take advantage of that in trying to schedule specific surgeries during that time period? Because I think the window closed, September of last year.
Yes, Senator. So
what did you guys do to maximize that 7 to 9 time payout?
So we did our best to maximize the funds that were available through COVID, while still during that time period having to be very sensitive about the types of cases we did and the number of cases we did to limit exposure also to our team. So cases were done through very careful case selection during that period, but we continued to operate the entire period.
Okay, excellent. I wanted to touch a little bit, with dealing with, I think I read an article and they were talking about the morgues in the territory. What's really happening with that? Because, you hear a lot of conversations, and I'm more about dealing with going straight to the source than hearing things outside. What's really going on with that?
Sure, and I appreciate that approach. I heard some of the same stories that you did and read some of the news reports that were on the morgue situation in the territory. Most of that discussion is really centered around the conditions and situation in St. Croix. On St. Thomas, at Schneider Regional, we have a functioning morgue, and I believe the Department of Justice also has a functioning morgue here in this district. So in this district, we don't have some of the situations and conditions that were reported in those articles that you're referring to.
Well, I am very happy to hear that. I think for me, several years ago, when my brother was murdered, there was a major issue with the morgues, and I literally sped through and got him buried in a week because I was very concerned about what was happening at the hospital. Mm-hmm. So it's good to hear that those have been improved, and to the point that it's not really an issue now in this district.
Thank you, and my condolences for your loss.
Thank you. When it comes to the nurses and dealing with the traveling nurses and, coming up with the close of this contract, it's almost, I feel a little bit uneasy because I know we need the help, but if I was in the hospital and I'm making $30 an hour, and the person next to me is making $200 an hour doing the exact same thing, that would deflate my entire spirit.
Yeah.
How do you deal with that, and what are you guys seriously doing in regards to the reduction of utilizing of some of these temporary situations? And I know you guys are talking about tapping into having a standard fee and increasing, but what is the normal time frame you think that could actually come about? Mm-hmm. And do you think that would be enough to really retain and really recruit nurses to the hospitals here in the territory, even specifically at Schneider Regional?
Yes, Senator. So I think that we are working really expeditiously now at this point to get to the table and I think get the new salary rates agreed to with the unions. We want to be aggressive in our number. We don't want to undercut our permanent nurses. We appreciate and definitely highly value our permanent nurses. We know it's been hard for them to see what others are getting. I don't know that it's 200 versus 30, but it might be 30 versus 45. But they also have housing.
I just tossed out a number.
Time.
Yeah.
Okay.
So we have to do better by our local nurses, and this team is committed to doing that. I think once we do fix the rates, and hopefully those become effective October 1 of the next fiscal year, we will have a good package at that point with the raises and the retention bonuses to go out there and successfully use our new branding and our new advertising to really reach people and encourage them to join our team. I think we have a great hospital, we have a good team, it's a nice place to work, it's a nice place to live. We just have to be competitive and recognize the true cost of living.
Mr. Chair, may I ask my final question?
Yes, you may.
Thank you. I really wanted to know, earlier when I was listening to the testimony, you spoke about dealing with claims and delay, crossover, et cetera. What do you think is the major issue that happens with that and why?
I think mostly with that specific situation, there's a IT technical failure, let's say, between our system, our claims processing system, and the claims receiving system. And so how we're working through that while we fix the IT connectivity is doing, unfortunately, a manual spreadsheet type process where we still need to get paid for those claims. And so we're doing what we can do to still go after them while we fix the IT connection in the background. And I think we continue to strengthen that relationship with the payers. It will get better over time.
And do you think financial-wise, do you think it's an issue of getting additional funding to make sure that your IT is up to par, or do you think everything is okay, or it's just human technical errors?
I think it's more system error than human error.
Okay.
I think additional funds definitely help us advance our IT projects across the board. And I think it's fixable, and we're going to continue to work to fix it.
Okay. Thank you, Mr. Chair, for the additional time.
Thank you, Senator Francis Heiliger. In reference to your testimony, I'm going back to the page 8 where you said Medicaid patient had charges totaling $17,061, but you only received a daily rate of $1,654. Explain that a bit more, the daily rate of $1,654. Well, what percentage are they using? What is that based on?
Sure, Senator. So for Medicaid and Medicare, we receive a fixed daily rate under the way we're reimbursed by those programs. And so it doesn't matter how much care we deliver to the patient on that day. What we're going to get paid is the daily rate. Now, at the end of the year, there is some level of a true-up with the cost report. But for this patient's example, let's say they came to the hospital in a extensive acute situation, and we provided a lot of resources to them. We provided a lot of blood products. We had to take them to the OR and do surgery. Sure. We had to do all the things that we had to do to take care and stabilize and treat that patient and put them in an inpatient bed. We may have spent $17,000 in costs, supply costs, equipment costs, staff costs, but we get the daily rate.
One second, and this is the highest amount?
This is one example that I think is a reasonable example. It's not extreme. This happens frequently. And so we try to use a realistic example.
Okay,
and the knee surgery case is a real example also.
So at the end of the year, do you get to true up the difference between the $1,654 and the $17,061?
At some level, yes, Senator. We are able to true up through the cost report. Then eligible costs that are recognized are trued up, and we do get some level of a fix there, but it's not covering historically dollar for dollar the amount that we expend on that care.
So this is one of the areas that we are lobbying our Congresswoman to look at?
That's part of improving the daily rate that we spoke about with Senator Sirot. Yes, sir.
Okay, we got to seriously do something with that. Are we on track to reestablish a fast track unit?
So we have a fast track unit that's fully outfitted, and our challenge with opening it on any given shift is our staffing. It's tremendously helpful in reducing some of the throughput issues that we have in the main ED, and so we need to staff it so we can open it so that we're providing a better service to the community and the
So
VA.
you're trying to staff it with PAs?
Staffing is the issue there. Mostly, yeah, either PA or NP, supported by the physician in the emergency department, and really it's needing staff nurses to add to that complement.
You're implementing a new uniform policy effective October 1st, 2022?
Yes, sir.
Okay, navy blue?
It's going to vary depending on your position, which is easier for the patients to then recognize who is taking care of them. So when somebody comes to your bedside in dark blue, you will know they're a registered nurse. When somebody comes in a purple, you'll know maybe they're a CNA. And when the doc comes, they're wearing their white coat. It's for ease of identification for a patient.
Okay. And the same color for all units?
All units will have the same color depending on your designation, your clinical capacity, essentially.
Is there a uniform stipend, or the nurses go ahead and purchase it on their own?
Yeah, so there is a uniform stipend dictated by some of the collective bargaining agreements. One bargaining agreement that doesn't have it in is VISNA, which is our staff nurses. But because we recognize that this is a change in policy and we're requiring them to wear this color, we are supplementing them this year with the initial uniform allowance to allow them to buy 3 changes at least.
So it will just be across the board that you'll give a stipend for 3 uniforms?
Yes, the uniform allotment will be given in accordance with the CBAs, and where it doesn't have an allotment in the CBA, we are giving it across the board to the staff we're requiring.
In this present negotiation for nurses, how long have the nurses been negotiating with collective bargaining? Because not only nurses at the hospital, it's Department of Health and all the other nurses involved. So how long has this negotiation been taking place?
So within the union we participate in, it's SRMC nurses, JFL nurses, and DOH nurses. And I think both management and the unions have wanted to get to the table for some time. And now we just need to really put the resources behind it and sit at the table and make it happen. We understand how much we're bleeding and that we need to fix it.
Okay, but you're not back to the table yet. I heard you were supposed to be back in July. You didn't go back in July.
We had a pre-management meeting with the management entities. We've further clarified the pay plans. Those are all submitted to OCB now. We've done our costing, and so we're waiting for a date to sit at the table with the unions.
So you're waiting for OCB to set that date?
For a date, yes, sir.
Okay, and the nurses have been complaining that OCB have been pushing off the date on a regular basis, and the hospitals are ready. Department of Health is ready, but OCB is the one factor that has held up the entire process. I also am privy to the fact that there was a meeting with the executive branch in which it was promised that the nurses would be back to the table months ago. And that didn't happen, and that's what resulted in the protests and everything else. But we need to settle this, and we've been asking OCB to settle this matter with the nurses. We want to, as much as possible, what we really can, but we want to try to retain as much nurses as possible and don't have our nurses also becoming travelers, because it's both ways. You know, we at one point we complained about the travelers being here, but our nurses are travelers and they're going to Texas and one went to Hawaii and they're receiving excellent compensation, so they're taking advantage of that. So the whole field of healthcare is now in the most difficult place it has ever been.
Agreed.
So we have to be creative in the Virgin Islands as to how we're going to be able to move forward. I'm going to allow you to close, but I'll do a quick point of inquiry, because he asked for it from very early, Senator DeGraff.
Thank you, Mr. Chair. Along the same lines, in your anticipation of the $3 million plus for nurses wage increases, does the fringe include any anticipation of the increase for healthcare?
That amount, Senator DeGraff, includes fringe. The $3 million estimate includes the fringe, and it's based on comparative research that was done in terms of what the competitive salary needs to be over this next, let's say, 2 to 3 year period.
Right, but I mean for the healthcare increase. There's an anticipated healthcare increase. You're asking for this amount of money, which is an increase, but do you have an estimated increase for health insurance? Because it's liable to be going up at the end of the year.
Yes, sir. To the extent that we have calculated the benefits, we've done it based on what the current rate is and as best as we know the projections to be. We haven't seen the new rate necessarily yet for the plan, so we are using our best estimate based on what we're paying now.
All right. Thank you. Thank you, Mr. Chair.
Okay, thank you so much. We'll be able to more than likely provide you with a rough estimate as to the increase in health insurance, so that you can begin to use those figures to calculate your fringe. I'll allow you to put a closing statement on the record at this time.
Thank you so much, Chairman Viole. Appreciated the conversation, the robust conversation that we've had today, and I appreciate the pledge of support from this legislature in helping Schneider Regional be the best hospital it can be. As we've discussed today, attaining more staff, especially nurses, is one of our top priorities. We're committed to improving salaries, and we want to have just be as competitive as we can be on the national market. We appreciate the nurses, our clinical staff, our providers, and really all of our staff for the work that they do and for sticking with us, especially through COVID and other natural disasters, and just doing their best to take care of our patients. We really, really appreciate that. The entire community appreciates that, and we want them to know how valued they are. We are working to train the professionals we need where we can. We're working to improve our facilities. We're working to upgrade our technology. We're so excited about moving to Meditech Expanse and just advancing other projects, being more patient-centered and friendly and easy for the patient to connect with us. We want to maintain a high level of service. We want to maintain our accreditation with Joint Commission and CMS and all the other regulatory bodies, and just maintain a high level of service and a commitment to the community that makes us a high reliability organization who the patients like to come to and who recommend us to others, their families, friends, and neighbors. We want to make our patient experience more pleasurable. We want to work on our ED throughput, and you really have the commitment of this team and myself to do that. We appreciate your help, and we need your help in addressing the larger issues that we discussed today, to include payer mix, unsafe discharges, and importantly, the lack of the competitive salary. We definitely hope that our presentation today provided you and the community with more information about our operations and about the work that we do at Schneider Regional, and hopefully built your confidence in coming to us for your care. We want to continue to provide quality health care to the community, and just want to close by thanking our staff one more time. Thank you, thank you, thank you. None of the things that we do is possible without our hardworking, committed, and dedicated staff. So thanks for the opportunity, Mr. Chair. Thank you to all the senators for your very thoughtful questions and your support. I'm excited to be on this team. I'm excited for our mission and the direction we're going in. And with that, we close and wish you all a good rest of the afternoon.
Thank you so much, CEO Comissiong, and thank those members of your staff that assisted you today in your presentation. The Committee of Finance will recess for 5 minutes. The Committee of Finance is back on the record. Next, before us, we have the St. Thomas Eastern Medical Center with the Executive Director, Moleto A. Smith Jr. I'm going to allow you to put your name and title on the record. Then I'll allow the members of your team to do the same. You may proceed.
Good afternoon, everyone. Moleto A. Smith Jr., Executive Director, St. Thomas East End Medical Center Corporation.
Thank you so much. Next.
Renee Crawford, Deputy Executive Director with St. Thomas East End Medical Center.
Next.
Dr. Barbara Douglas, Medical Director.
Next.
Francia Bryn, Chair, Board of Directors.
Next.
Good afternoon, Eric Baines, Chief Financial Officer.
Good afternoon, Dr. Zen Mustervi, Director of Behavioral Health.
Thank you so much. We will begin with Ms. Bryn.
Good day, Honorable Senator Kurt Vele, Chairman of the Senate Committee on Finance, and to the members of the Committee on Finance, other members of the 34th Legislature, members of the St. Thomas Eastern Medical Center Corporation's Board of Directors, its leadership team, and other staff, patients, and others in the viewing or listening audience. I am Francia M. Bryn, Chairperson of the Board of Directors of the St. Thomas Eastern Medical Center Corporation, known as STEAM-CC. On behalf of the STEAM-CC Board of Directors, I thank you for this opportunity to present STEAM-CC's Government of the Virgin Islands Fiscal Year 2023 budget request and recommendations in the amount of $2.1 million. It must be noted, however, that the amount of $2.9 million more accurately reflects the health center's funding requirement. STEAM-CC is a private, not-for-profit corporation organized under Title 13, Chapter 3 of the Virgin Islands Code since 2000. The only federally qualified health center in St. Thomas, St. John District of the U.S. Virgin Islands. The organization is governed by a board of directors of between 9 and 15 members comprised of persons from a cross-section of the community. The majority of board members utilize the health center for their health care needs as required by federal statute. At present, there are 11 members on the board. As COVID-19 moves into the endemic phase, it is important to emphasize the continued combined heavy impact on health issues being faced by a high number of residents, due in large part to the 2017 Category 5 hurricanes, followed by COVID-19 global pandemic, which for many is ongoing. Comorbidities combined with being separated from routine care and monitoring due to COVID-19 restrictions have had the effect of exacerbating health conditions for persons with hypertension, diabetes, and other chronic diseases. Moreover, increases in incidence of depression, anxiety, trauma, and other disorders among children, the elderly, and others in our community during this period has raised the alarm for STEAM-CC to continue concentrate focus on addressing this unmet health care need. Throughout the past year, STEAM-CC had concentrated its efforts on the following areas through strategic planning and service delivery: recruiting providers, retaining the health center's workforce, connecting individuals suffering with hypertension, diabetes, and behavioral and mental health disorders to care, including through direct service, case management, and other activities, maintaining a safe health center environment for staff members and patients that is free from hazards, including COVID-19, developing a 3-year STEAM-CC strategic plan, initiating architectural engineering activities for the construction of a new STEAM CC Health facility. As the health center continues its efforts to address the health care needs of our patients and the community we serve, our strategic focus is as follows: providing services to Medicaid eligible residents not utilizing their support for health care, addressing the growing issues associated with meeting specific wellness and health care for seniors through focus programs, ensuring that language is not a barrier to effective health care and wellness for residents with inadequate English skills at this time, developing programs with partners that help single-head families and residents with low income to access services that support wellness, developing a strategy to address the challenges of accessing services from other sites linked to STEAM CC and thereby decreasing transportation and child care challenges, establishing outreach efforts that identify successful strategies for decreasing non-communicable diseases in the St. Thomas St. John district, planning outreach to partners and the community, effective communication with internal and external stakeholders, buy-in and contingency plans to support success as a means of addressing unmet community health needs. The challenges being faced currently by every healthcare organization, including STEAM CC, are indicative of the uncertainty of the times in which we live. Global warming, unprecedented levels of infectious diseases, escalating costs associated with delivering care to a larger and more acutely ill population, combined with resources limitations. These challenges require all of us to work more closely to leverage our resources and to innovate in ways that meet the expectations of the communities that we serve. Towards this end, STEAM CC is essential to our community and a lifesaver for many of our residents. On behalf of the STEAM CC Board of Directors, I thank each member of the STEAM CC staff. Their work and commitment during this period of public health emergencies is a testament to their professionalism and dedication to patients and community. Thank you for your ongoing commitment and service. I also wish to thank our community stakeholders, partners, and especially the individuals who have chosen STEAM CC as their healthcare provider. I also wish to express sincere appreciation to the members of the legislative and executive branches of government for your continued support of STEAM CC and the essential work which we do for the community. In the testimony which follows mine, STEAM CC's Executive Director, Moleto A. Smith Jr., will provide highlights on the health center's activities, detail on the appropriation request, and a summary of priorities for the upcoming funding cycle. We respectfully request approval of the recommended appropriation in the amount of $2.1 million. We further request your serious consideration for the approval of the amount of $2.9 million, which more accurately reflects the health center's funding requirement. Thank you very much.
Thank you. And you may proceed, Mr. Smith.
Good afternoon again. Finance Committee Chairman, Honorable Senator Kirk Viale, members of the 34th Legislature's Committee on Finance, other members of the 34th Legislature, the viewing and listening public, greetings to everyone. I am Moleto A. Smith Jr., Executive Director of the St. Thomas East End Medical Center Corporation, otherwise known as STEAM CC. On behalf of the St. Thomas East End Medical Center Corporation, thank you for this opportunity to present our Government of the Virgin Islands Fiscal Year 2023 budget appropriation request in the amount of $2.1 million. It must be noted, however, that the amount of $2.9 million, which has been requested by us in numerous previous years, more accurately reflects the health center's funding requirement. Appearing in person with me today are the following persons: Mrs. Francia Bryn, Board Chair; Ms. Renee D. Crawford, JD, Deputy Executive Director; Dr. Barbara G. Douglas, Medical Director; Dr. J. Zen Mazurvi, Behavioral Health Director; Dr. Lucian Molinar, Dental Director; Mr. Eric Baines, Chief Financial Officer; and Ms. Lisa Webster, Director of Communications and Community Engagement. On Friday, August 12, 2022, in recognition of the 2022 National Community Health Center Week, STEAM CC closed out a week of activities by providing outreach services to the homeless individuals at Catholic Charities on St. Thomas. This year, 2022, is also the health center's 22nd anniversary of serving the health needs of the St. Thomas St. John community. As I begin my testimony, I want to acknowledge the STEAM CC staff, which in my view is the best. Over the past 5 years, this is to say, from day one after Category 5 hurricanes Irma and Maria in September 2017 to present, including through the catastrophic impact of the COVID-19 global pandemic on health systems around the world, STEAM CC has remained open and fully operational. We have expanded access to key areas of health services, including behavioral health and case management, while continuing to go the extra mile or more to educate and serve our patients. These achievements are only possible through the commitment, dedication, and competence of our staff and the support of our board of directors. Thank you to every member of the STEAM CC team for all that we do to care for our community. STEAM CC is the largest medical organization on St. Thomas. We serve all types of patients regardless of ability to pay. In addition to a sliding discount fee program for eligible individuals, all forms of payments are accepted, including commercial insurance, Medicare, Medicaid, and other public insurance. Additionally, we provide translation services for patients who do not speak English, as well as financial counseling services to all patients. The health center provides a full scope of preventative health care services, including oral/dental health, behavioral and mental health, internal medicine, pediatrics, family medicine, OBGYN, case management, and laboratory services. Unduplicated patients and patient visits. Despite the tremendous impact of COVID-19 global pandemic on St. Thomas St. John community throughout the 2021 calendar year, STEAM CC provided preventative health care services to 6,448 patients, of whom 4,159 were female and 2,289 were male. A total of 2,156 individuals are patients below the age of 18 years. 6,042 patients were 100% and below income as a percent of the federal poverty guideline. Total patient visits for this period were 21,575, of which 3,271 patient visits were attributable to mental health conditions, substance abuse disorders, and related conditions. COVID considerations. STEAM CC continues to provide measures to keep the patient population and staff safe from the infection with COVID virus, namely triaging, temperature screening, spot testing, social distancing, and continued wearing of masks. COVID is still very present and contagious. Risk management and quality metrics to date. STEAM CC places highest priority on delivering the highest standard of care to our patients. Toward this aim, the health center's performance meets or exceeds national quality standards as related to medical provider performance review, nursing documentation, postpartum follow-up, newborn follow-up, after-hour call follow-up, health information technology compliance, STD follow-up, and other required clinical screenings and follow-up. Some of the performance areas routinely monitored include the following: behavioral health, referrals seen within 1 week, lab follow-up, ensuring injectable psych medications administered, medical provider performance review, appropriate diagnosis, appropriate exam, medications dosed correctly, nursing documentation, blood pressure, last menstrual period, smoking history, temperature, oxygen saturation, pulse, respiratory rate, weight, height, BMI. Moreover, STEAM CC emphasizes continual risk assessment and the development of comprehensive clinical policies, procedures, compliance training, protocols, investigations, plans, and implementing risk management strategies and processes, especially in matters related to COVID-19. Behavioral health services. We remained open throughout the COVID-19 pandemic for in-person psychiatric and psychological evaluations and assessments for urgent psychiatric needs. Telehealth services were further developed, provided, and utilized. Increased behavioral health access with an increase of providers and support staff. RTMS, repetitive transcranial magnetic stimulation, which is an FDA-approved state-of-the-art treatment for major depression, and now FDA-approved for obsessive compulsive disorder. Non-medical treatment options for individuals with comorbid health problems where psychotropic medication is not tolerated. Treatment-resistant major depression and/or obsessive compulsive disorder. Adverse side effects to antidepressant medications prohibiting adequate treatment. Current ongoing research is showing efficacy in treatment support of other disorders such as anxiety, substance abuse and addiction, post-traumatic stress disorder, stroke rehabilitation, schizophrenia, Parkinson's disease, Alzheimer's, migraine, headaches, and chronic pain. STEAM CC is currently the only TMS provider in the Caribbean. Emergency preparedness via support from Yale University, Emory University to include mental health, behavioral health, STEAM CC staff training in trauma-informed care as well as acute trauma care. Response team, for example, includes mass shooting and other traumas. Injectable medication treatments, 33 plus individuals per month and increasing. We are consistently 98 to 100% compliant with these injections. Providing coordinated care and services for patients at Community Mental Health Clinic, Eldra Schulterbrand, Yellow Cedar, Schneider Regional Hospital, Homeless Clinic, numerous healthcare and physicians' offices in the community. Also provides individual mental health reports and coordinated care for the courts, for disability, for special housing needs, as well as vocational rehabilitation and others. Hundreds of prescriptions are written each month for the behavioral health care. Upcoming national trends in behavioral health and initiatives include racial ethnic disparity. Despite reforms and current initiatives, the disparity of affordable, ubiquitous mental health care for Black and Latinx youth remain grave. Additional barriers being actively assessed. Mistrust and misperception of health and mental healthcare often based on discrimination and lack of access to the best evidence-based treatments and evaluations. Access of digital and technological advances, providing access to newer and more innovative treatments, such as internet connection to specialized therapeutic games, programs supporting treatment, and evidence-based treatment. Trauma care, mass trauma treatment, acute care, individual and longer-term trauma assessment and treatment, genomics and biological specific factors and treatments, examples such as individualized evidence-based treatment for improved outcomes, special population mental health assessments, such as research-based mental health outcome and assessments for preterm born children, early intervention. Medical services. The impact of COVID-19 global pandemic on STEAM-CC patients with chronic diseases. COVID-19 has affected the medical profession globally, to include the Virgin Islands. For 2 years, due to the COVID-19 restrictions, certain patients were unable to be seen as they were before the beginning of the COVID-19 pandemic. Many patient visits were telemedicine visits. Correspondingly, many patients missed the benefit of face-to-face contact that they had in the past. As a result, the routine monitoring of labs and exams could not be done due to the pandemic-related restrictions. As a result, chronic diseases for some patients, such as diabetes and hypertension, were not as well controlled, which may have led to increased hospitalizations and or other significant impacts. For this reason, chronic disease management is a health center principal focus. Initiatives to address chronic disease management. STEAM-CC is in partnership with the Federal Health Services Research Administration to research the possibilities of using artificial technology to control blood pressure and diabetes. Types of artificial intelligence include Wi-Fi blood pressure cuffs that record the blood pressure reading of the patient at home and transmits the readings to the provider's office. For diabetes management, there are smart pens, which help to calculate the amount of insulin that the patient needs. STEAM-CC was designated to accommodate training and education on chronic disease management, specifically hypertension. Funding for this segment of outreach was made possible by a grant from the National Hypertension Control Initiative, addressing disparities among racial and ethnic minorities program in STEAM-CC. Criteria for STEAM-CC patient participation is a 160/80 or higher blood pressure reading, access to a smartphone, and a signed commitment of participation. All participants receive a Withing blood pressure monitoring Connect Bluetooth Wi-Fi cuff. Patient participation is required for a period of 1 year. Dental services. In general terms, dentistry, also known as dental medicine and oral medicine, consists of the study of diagnostic, prevention, and treatment of diseases, disorders, and conditions of the oral cavity, commonly in the dentition, but also the oral mucosa and of adjacent and related structures and tissues, particularly the maxillofacial, that is the jaw and facial area. Although primarily associated with teeth among the general public, the field of dentistry or dental medicine is not limited to teeth, but includes other aspects of the craniofacial complex, including the temporomandibular joint and other supporting muscular, lymphatic, nervous, vascular, and anomatic structures. STEAM-CC provides the following scope of dental services: primary care for adults and children, radiographs including oral cancer screening and oral preventative services, fluorides, dental sealants and other prophylactics, dental restoration, extractions, and complete or partial dentures, dental hygiene services. Current and upcoming initiatives. Implementation of the 2022 to 2025 STEAM CC 3-year strategic plan. Rollout of the 340B discount pharmaceutical program. Groundbreaking on a new STEAM CC facility. Retention and recruitment of providers. Workforce development and capacity building. Healthcare succession planning. Community outreach and engagement. Expand behavioral health services through community collaboration. Collaborate with Yale and Emory universities and other key stakeholders to develop a comprehensive disaster plan that includes education, planning, and preparation strategies for our patients, providers, and service organizations in the event of a disaster. The plan is focusing primarily on 3 areas: patients with chronic disease, decreasing morbidity and mortality in the wake of a disaster, children, helping children learn coping skills so they are better able to handle disasters, special needs children, accessing our current resources and services to make sure we are able to properly care for our special needs children. Partner with the Non-Communicable Disease NCD Collaborative for Diabetes Management and Prevention to help improve health outcomes. The following area gives our budget overview and breakdown, and Mr. Eric Baines, CFO, will facilitate us through that section.
Good afternoon, everyone. The Governor of Virgin Islands 2023 budget overview and breakdown is as follows. The information provided below features a breakdown of STEAM CC's budget requests totaling $2.1 million for the upcoming.
Slow down.
All right. I'll repeat that. The information provided below features a breakdown of STEAM CC's budget requests totaling $2.1 million for the upcoming Governor of Virgin Islands fiscal year. HIV program. Considering the severe need for services to these patients within the territory and the district we serve, the board made a decision to use operational funding received from program income to continue providing patients with HIV counseling, testing, and primary care. No funding from the local government has been specifically designated to the health center for such services. However, the continuation of this funding source remains uncertain. STEAM CC continues to apply for HIV program funding as they become available. Financial obligations. STEAM CC recognizes the high cost of preventative and interventional services and realizes that many patients still struggle with being able to meet their medical and dental health obligations. We have therefore set aside funds to assist patients who are unable to pay for their mammograms, pap smears, prostate screening, radiographic studies, colonoscopies, transportation, and medications. We provide financial assistance to patients without insurance who qualify for our sliding scale fee discount program. For those patients who cannot afford to pay in full for services, we offer a payment plan. We have therefore set aside funds to assist patients who are unable to pay for their mammograms, pap smears, prostate screenings, radiographic studies, colonoscopies, transportation, and medications. Excuse me. Listed are the graphs of the various funding sources for FY20, 2021, and 2022. FY22 funding sources are broken down as follows. Program income, $4,712,132. VI government grant, $2,100,000. Federal grant, $2,391,205. Medicaid retro, $1,597,438, totaling $10,800,775. Budget assumptions, program costs. Following are the categorical descriptions and budget justifications for the program cost groupings contained in the detailed budget schedules, which are found at the end of this budget presentation section. Personnel salaries. Salaries for 84 full-time employees have been budgeted at $5,793,608. Support staff complements the provided changes. Staffing for years subsequent to 2022 will be adjusted to ensure maintenance of appropriate staffing levels are maintained. Employee benefits. Employee benefits have been budgeted at $906,621 and include the benefits offered to staff to maintain a competitive employment package. The center's budgeted 223 benefit rate is approximately 17% and is composed of the following: life, disability, and health insurance, employee FICA, pension, unemployment insurance, or workman's compensation insurance. Costs associated with employee benefits are anticipated to increase by a minimum of 2% for each year. Contracts and consultants. Contracts and consultant services have been budgeted at $1,919,729. Professional services include audit, legal, biowaste disposal, etc., at $773,000. Medical programs such as lab, pharmaceutical, radiology, nutrition, pediatric, dental, and outreach services are at $538,000. The balance of costs is primarily payments to provider staff at $563,729, which covers 2 part-time OBGYN physicians, 1 full-time dentist, 1 part-time pediatric dentist, 1 part-time nutritionist, which we're actually recruiting, 2 part-time psychologists, 1 part-time pharmacist, 1 pharmacist assistant, translator service, and on-call services. This category is expected to experience inflationary increases of 2% over the next 3 years. Supplies. Cost of supplies utilized in the course of patient care includes items used in medical and dental services delivery. Laboratory reagents and immunization supplies have been budgeted at $375,000. Also included in non-clinical general supply costs, such as office supplies, miscellaneous fees, printing, and uniforms. Expected pricing increases for the next fiscal year have been included in each category. These inflationary factors range from 2% from general office supplies to 7% for pharmaceuticals. Inflation factors have been projected to continue over the next 3 years. Costs of business-related travel have been budgeted at $30,000. This cost of approximately 27% attributable to the administrative staff and approximately 73% attributable to patient care staff. Examples of business purposes include education and/or industry updates in reimbursement, patient care, quality assurance, ERISA requirements, etc. Additionally, travel costs are incurred to attend local and national industry associations, meetings, and other continuing education. This amount includes the cost for staff to attend continuing education seminars. Costs will be controlled through review of local seminars, teleconferencing, and webcasts included instead of our out-of-territory conferences. Equipment. The cost to cover the purchase of computers and software upgrades is at $25,000. Facility. Administrative and maintenance services. The costs are broken down as follows. Rentals, which is spaces, land, and offsite storage, is $832,665. Communications, which is the cost of updating and upgrading in-house telephone and paging systems, answering services providers, on-call, and associated equipment maintenance costs, $246,000. Utilities, which is water and electricity, $240,500. Repairs and equipment, $98,000. Machine/equipment rental, $30,000. This totals to $1,447,165. Other services. Other services have been budgeted at $310,736. This amount includes recruitment, which is budgeted at $70,000. Recruitment costs includes classified and journal advertisements, candidate interviews, and telephone listings. Promotion, advertising, and events are budgeted at $91,204. Promotion expenses include patient mailings, patient newsletters, health promotions, materials, and events, National Healthcare Center Week, open houses, lose weight challenges, screenings, etc. General and administrative. General administrative costs are approximately $124,500, which includes postage, shipping, event dues and subscription, licenses, and professional fees. Insurance. Insurance costs have been budgeted at $40,000, includes the cost of building, contents, director's liability, valuable papers, and bond insurance. Federal Tort Claims Act coverage is utilized to minimize malpractice expense. Projected expenditures. STEAM-CC employment costs consist of salaries and benefits along with provider services are the source of the largest expense outlay to the corporation, representing about 67% of all expenses incurred by the organization. It is crucial that STEAM-CC be able to continue funding these positions as they are needed to maintain high standards of care. The projected expenses are as follows. Personnel services, $5,793,608. Fringe benefits, $906,621. Provider services, $563,729, which are total to total personnel fringe benefits provider services. These alone are 67%. Medical programs, $583,000, about 5%. Supplies, which is $375,000, which is 4%. Other services and charges, $1,131,652, which is 11%. And facility, $1,447,165, it's 13%. Program income. Net patient revenues projected from STEAM-CC's total operations include Medicaid revenue, $3,456,379. Medicare revenue, $350,082. Self-pay revenue, $244,019. Commercial insurance, $661,652, which bring the total net patient service revenue to $4,712,132. The center program income is based on their anticipated yearly patient visits. While there is continued increase in patient visits, STEAM-CC's largest payer class is Medicaid, followed by self-pay. As a federally qualified health center, FQHC, STEAM-CC provides a federally required sliding fee discount program for income-eligible individuals. This program is applicable to all services provided by the center. STEAM-CC continues to aggressively pursue collections and reduce age accounts receivable. The center collection rate is approximately 75%. Thank you.
In closing, I have requested the top-of-mind things that from each member of my leadership team and what they would want the members of this committee and other members of the 34th legislature to know about the work that we do. These are their responses. STEAM-CC is essential. We care for patients, especially behavioral health patients, in real time. We are a premier healthcare organization on St. Thomas. We operate at and maintain a high standard of care. We are proud that STEAM-CC is a location of first choice for dental services for a major part of the community, providing emergency care on a daily basis while providing the highest level of COVID-19 protection and mitigation. Also, it is important to note that through data gleaned through a STEAM-CC healthcare market assessment conducted by the University of the Virgin Islands Caribbean Exploratory Research Center for Excellence as part of the strategic plan development for STEAM-CC, it appears that STEAM-CC's vision, mission, and strategic direction aligns with the unmet needs of the community we serve. Our focus will continue to be as follows: providing services to the Medicaid-eligible residents not utilizing their support for healthcare, addressing the growing issues associated with meeting specific wellness and healthcare for seniors through focused programs, ensuring that language is not a barrier to effective healthcare and wellness for residents with inadequate English-speaking skills at this time, developing programs with partners that help single-head families and residents with low incomes to access services that support wellness, developing a strategy to address the challenges of accessing services from other sites linked to STEAM-CC, and thereby decreasing transportation and childcare challenges, establishing outreach efforts that identify successful strategies for decreasing non-communicable diseases in St. Thomas, St. John, planning outreach to partners and the community, effective communications with internal and external stakeholders, clarity, buy-in, and contingency plans to support success as a means to address unmet community health needs. I extend high praise for the members of the STEAM CC Board of Directors, which is comprised of volunteers, the majority of whom are consumers of the services provided by the health center. Their commitment, support, and continued oversight involvement has been paramount in STEAM CC's ongoing achievement as a high-performing organization. On behalf of all of us at STEAM CC, including our patients, we greatly appreciate the ongoing commitment of the legislative and the executive branches of government in supporting the essential work that the health center has been doing over the past 22 years. Thank you. We await any questions that you may have or which may arise.
Thank you so much for your testimony, Mr. Smith. Colleagues, we're going to begin with a 5-minute round, beginning with Senator Blyden. Senator Blyden, you recognize.
Thank you so much, Mr. Chair, for the time. Good afternoon, Mr. Smith and Board Chair Brain.
Good morning. Good afternoon.
Thank you for your testimonies.
Good afternoon.
And good afternoon to your supporting team there with you. I love being freeze for a second. Listen, let me ask you, before I begin, because the post audit report, Mr. Your money guy, what's your name again, sir?
Mr. Baines?
Mr. Bain, Eric Baines.
Good afternoon. Yeah, I know I spoke to you offline and I spoke to the post auditor. He said he did not receive the information for some reason. It probably got lost in transition. So if you can resubmit, that'll be good. Okay?
Yes.
Because most of my line of questioning usually comes from that area. But I'm sure you have that information, so I'll still question you, okay?
Mm-hmm.
First of all, in respect to vacancies, how much vacancies do we have at the MCC?
Currently, the vacancies that we have relate to the recruitment of providers. You may have seen across the territory in our advertisements that we have both locally and nationally, regionally advertised for psychiatrists, psychologists, OBGYN providers, family medicine providers, dentists. So our vacancies, the biggest area of recruitment is doctors.
How much vacancies number? Give me a number.
I would say I would say at least 6.
6 vacancies?
Yeah, 6 in the area of doctors.
What impact negatively does that have on your operations?
I note that we speak a lot about the various things we do in healthcare. But if you don't have doctors, you don't have healthcare. So the impact is direct. We can't see the number of patients that we need. You have waiting lists for services, particularly in dentistry, and you put a burden on the existing providers that have to double up and can't take vacations.
Okay, very well. And I note in your testimony you mentioned you have 84 full-time employees, and 5.8 million have been budgeted for 22 for that category. But how much have been expended to date in terms of our personnel costs? Do we know?
We have no carryover personnel costs. So whatever is budgeted between the local appropriations and our other federally funded grants come through.
Year to date, how much has been spent for personnel costs?
I can get that for you, but the full budgeted amounts have been spent to date. I can get the exact number for you.
See, because it's good for us to know exactly.
Yeah, I think our payroll cost is about a little over $500,000 a pay period.
Yeah, but it's good to know. I need to know that number in terms of how much has been expended year to date. Also, in respect to your outstanding do you have any outstanding balance when it comes to your, because I know we did not get a professional service contract listing, or do you have any outstanding balances in terms of your professional service contracts?
The professional services contracts that we have are primarily for providers who are on contract, and they are paid as part of our payroll system. So there are no outstanding professional services in that regard.
Also, I note in the testimony, it was mentioned in respect to your federal grants, $2,391,205. Federal grants, have all those funds been expended also, because we don't have the listing, and I do not know what they are for, etc.
Okay. We did receive some COVID funding in 2021 that expired early part of 2022. Those all have been expended and properly closed out.
And what were they for?
The one was part of the CARES Act that came directly to the health center. We used that to expand behavioral health, to support our outreach in certain areas, to bolster staffing in areas such as behavioral health, dentistry. So most of it was used for staffing. So it was used for the purchase of the TMS machine and training that we had just mentioned. So that was the use of the money, and the other was really to support testing of COVID testing for patients as well as our workforce.
And let me ask you, in your testimony also you spoke to $375,000 for supplies, but I note in the post report it does not have an entry for supplies for 2021 or 22. The 375, what encompasses that amount for supplies? And why such a large variance?
Supplies covers both medical and clinical supplies, administrative supplies. Primarily, those are the areas that cover supplies.
And
I'm not too familiar with the post audit report because we recently received it a few days ago.
It's okay.
We're able to vet it.
It's okay. Other services and charge, $734,540. What's in that category, and what will that $734,000?
Yeah, can you repeat that question for me?
Other services and charge, $734,000. What encompasses in other services and charge?
Could you repeat the area again, please? Servicing and
other services and charge for $734,000. What's included in that category? You don't have such a category?
We don't have. Okay. I'm not sure how that's broken on here. Other services.
Okay, Senator. You may conclude. I just realized that that I did. Go ahead. You may conclude.
I was going to wrap up. I was going to wrap up. I'm not fair.
I'm not sure.
14.
And that's my last question. Mr. Chair, apparently there's some. Because they're not sure about other services and charge.
Do you guys have the post-audit report, though?
Yeah, they have
Yeah,
it.
we just received this today.
Yeah.
So, but it should still correlate with the numbers that you have.
I don't think they have that in there.
Okay, let me see.
So, Mr. Chair, you can wrap up. You can.
Okay, there is. These would be services for recruitment, special programs, National Health Center Week, and particular staffing that may come on for special related programs.
Okay, thank you so much.
And the associated, expenses against that.
Thank you. Thank you for the response.
Okay, thank you so much, Senator Blyden. Senator Bullquist.
Thank you, Mr. Chair. And greetings and good afternoon to the board chair, Bryn, our executive director, Smith, and the administrative leadership of the St. Thomas East End Medical Center.
Thank you.
Good afternoon.
Your entity is significant in the healthcare system of the Virgin Islands. Your increasing importance on the role of wide-ranging services offer a full spectrum of care that a hospital setting may not otherwise offer. So I really appreciate your entity and what it does here for our citizens in the Virgin Islands. You mentioned in last year's budget report that you implemented a behavioral health program.
Correct.
I was wondering, how many patients have you treated this fiscal year?
What I'd like to do, since our behavioral health director is here, is to allow him an opportunity to speak to that and also speak to his program.
Okay.
Good afternoon. I can't give you a direct number of offhand of how many patients, but as reflected earlier, approximately 1 out of 6 patients that come to the health center are receiving services or on a daily basis for mental health.
Okay, and concerning abuse and addiction, how many professionals do you have on the staff, and how many patients have you served in that area?
We service consistently. Again, I can't give you the direct numbers, but on any and every day basis, we'll service 1 or more patients that have a comorbid substance or addiction issue. As far as staffing is concerned, we're very minimally staffed, but I've been working in this for a long time now as the primary psychiatrist here on St. John and in St. Thomas, and generally I prescribe well over close to 1,000 or more prescriptions a month.
Okay, that's good to know.
Yeah.
Also, I wanted to find out, with the COVID funding that you've received, have you expended all of it?
Yes, we have.
You have? Okay, good. In your testimony, you also mentioned the design of a new facility. I'm trying to figure out, is it going to be an additional facility? Are you leaving the facility that you're in right now, or is it going to be a second facility?
Well, we're currently in lease space, and we're building a health center-owned building. So it will be a new building that we will be relocating all of our services to that facility.
Okay. Where will that be located?
It will be, I'm trying to see how it's on the main highway leading toward the mall.
Okay,
it's across, it's right abuts the Leonardo Trotman Drive.
2 minutes.
On the road frontage area, that's where the site is.
Okay, so you've already purchased the land. There's already a cost associated with the build-out.
We have the land is owned by the Hartman family, and we have a very favorable long-term leasehold relationship because the land, commercial land in proximate now catchment area, is almost impossible to find.
Okay, very well. On page number 6 of the post-audit report, under medical programs, the St. Thomas Lab, I didn't see a funding source associated with that amount.
That is paid through program income.
Program income?
Yes.
Okay.
And that cost, if I may, that cost primarily covers self-pay individuals who don't have the ability to pay. So Medicaid patients and others who are insured patients actually would pay through those insurance schemes, but for the self-pay patients that we have a federal obligation to provide the services, that cost is associated with the self-pay.
Okay, thank you for that. And one last thing before my time is called. I was very happy to see that you have translators on board. Do you have translators for French-speaking and Spanish-speaking, or is it just Spanish?
We have on staff both French, Haitian Creole, Spanish, but we also have multiple translation services.
Okay.
That covers every language that is imaginable for translation services for patients.
So that's a service that you pay for. It's not necessarily a person who translates. But
no, we have on staff individuals who provide both French Creole and Spanish translation services. But in the event that there is a language that's outside of that we may not have the staff available for. We do have at least 2 other mechanisms to provide translation services.
And for individuals who are have hearing impairations, do you have any?
Yes, we do.
You do? Okay,
Yes.
excellent.
Time.
Thank you for the time, Mr. Chair.
Thank you, Senator Bolquist. Did you submit any of the information to the post audit?
Yes, we did.
When?
This was back in February, April, early when the initial request came. We also submitted it through OMB, and OMB also indicated to us that they would be responsible for submitting the information down to post audit. But all the information that was requested through that we did submit.
To post audit or to OMB?
To both. We submitted it to OMB initially because our instructions were that OMB would be submitting that information down to the post audit.
The Committee of Finance will take a 2-minute recess. The Committee of Finance is back on the record. Our colleagues over at St. Croix, we were trying to get the fiscal year 2023 information so that we can do a comparison and be able to move forward in reference to the requests. Post-audit did not receive that particular information from OMB or the Eastern Medical Center Corporation. So what we're going to do, we are requesting that they send the information to post-audit by the end of the week, and we will do a new post-audit analysis, and we'll invite them back to come for just the budget part. So it won't be any repeat of testimony. We'll go directly to line of questioning by the senators based on the post-audit report. So at this point, we're going to excuse the St. Thomas Eastern Medical Corporation and get ready for the next group. This committee stands in recess for 5 minutes.